या यहाँ छेड़ते रहोगे ना, थोड़ा बहुत छेड़ते रहोगे, फिर ना होगा। ऐसे ऐसे एक बार कर दिया अब सारा समझा दिया।
कोई नहीं आया, कराओ आप ज्वाइन, आ गया
लाइव भी हो गया सर।
applause.
Thank you so much for this wonderful introduction. Good morning, everyone. First of all, I would like to thank Honorable Vice Chancellor Arun Garg sir and Professor Vinit Kumar with the organizing committee for inviting me to this second international conference on campus to corporate at MVNU University. So I'm very delighted to present a talk on drugging the undruggable, the story of RAS drug discovery. So today I'm going to take you to a journey of I hope you guys can hear it.
तो ठीक है ना? अरे ठीक है, इसको ट्रैक कर देते हैं। ठीक ठीक, अबे चल।
So, can you guys hear me?
Yeah, sir.
Is it? Can you guys hear me?
Yes, sir, you are audible.
Okay. Yeah. Thank you so much. So today I'm going to talk about a wonderful story of drugging the undruggable, the story of RAS drug discovery. So this is a wonderful story of a protein which was considered undruggable for almost 40 years. And then finally scientists were able to discover a drug against that protein. So it's a very beautiful story of how a protein which was undruggable became druggable with the persistent effort of the scientists.
वहीं से करके वो
यहाँ से होगा ये मत
थोड़ा सा और बस
Can you guys hear me, or is there any difficulty?
You are audible.
Vinit sir, can you hear me?
Yeah. You are audible, Ajit.
सर अपने मोबाइल से लॉगिन कर लो ना।
Yes, sir, you are perfectly audible.
Okay, perfect. So, hello.
Sir, you are audible and completely visible. You can.
So much. I appreciate it. Okay, so let's begin the story, and this is really very exciting and wonderful story, and it's very inspiring story that how consistent effort of scientists can make something which was believed that it's impossible to design a drug against this protein. So before we talk about the drug discovery story, let me give you some of the basics. So what is cancer? As the definition says, that the cancer is a collection of disease that occurs when cells grow unconditionally, uncontrolled, it divide unconditionally and spread to other part of the body. So as we all know that cell division is one of the basic property of the cells, and because of that we grow. Not only we grow, but also if there is any healing which is required happens because of the cell division. So the whole process of cell division is very tightly regulated, because at certain age or certain time we need to stop cell division, otherwise we'll keep growing. So the cell division has to stop, and this whole process of cell division is very tightly regulated, and that's why. But if any misregulation or dysregulation in the cell division happens because of any changes, that leads to uncontrolled division of the cells. And when cells divide uncontrolled way, it forms tumor. And when these tumors start spreading in different part of the body, that's how it becomes cancer. And that's how. So once they start spreading different organ of our body, those organs stop working, and that's how the death happens. So that's why. So if we talk about the overall global burden of the cancer in 2020, there was 18 million cases of the cancer, and out of which almost 10 million people died because of the cancer. And it has been predicted that in 2040, there will be around 28 million cases of the cancer, and 16 million people might die because of the cancer. So this shows that the cancer is one of the very lethal disease. Not only it's lethal disease, it's one of the most prevalent disease in human race.
लाइट लाइट चली
कंटिन्यूस चल रहा बंदा, उसको पता भी सीन चेंज मत कर। ये तो चार्जर लाइट लाइट चली गई अब क्या हाथ ला रहे
And among these three RAS isoforms, the KRAS is the most prevalent RAS protein which causes the disease. Like 70%, 75% of the all RAS mutated cancer happens because of the KRAS. So that's why there is a lot of effort to design drug against KRAS. So what happens is that if mutation happens in any of these RAS, especially in the KRAS, at either 12th position of the protein. So as you all know that the protein is made up of amino acids, right? So if we talk about the 12th amino acid, which is glycine, 13th amino acid, which is again glycine, and 61st amino acid. So these three amino acids are known to get mutated in KRAS or other RAS. And because of the mutation of these amino acids, the protein becomes consecutively active. So when the protein becomes consecutively active, it keeps dividing and dividing and dividing. Because of that, the tumor formation happens, and that leads to cancer. So I would like you to remember these three mutations. But among these G12, G13, and Q61 mutations, the most prevalent mutation is G12 mutation. So that's why there is a lot of effort to design drug against G12C mutation so that we can block the protein in its active form, which is its mutated form, and so that we can kill the tumor formations. So as you will see here, this is the bar graph you could see. So the green one here is incidence, the yellow one is the mortality, and these dotted lines are showing the prevalence of the KRAS mutations. So as you could see in the pancreas, most of it, like almost 95% of the pancreatic cancer happens because of the KRAS mutation. If we talk about the lung cancer, if you'll see around 30 to 35% of the cancer, if you will see here, of 35% of the lung cancer happens because of KRAS mutation. So this shows that this mutation is so much prevalent in all kind of cancers that there is a pressing need, a requirement to design a specific molecule which can inhibit this protein in its active form or mutated form, and so that we can kill the cancer. So before we talk about the whole process of drug discovery against KRAS protein, let me give you a little bit more information about this protein. So before we get into the more information about the protein, one thing I would like to pay attention to is that when we talked about this G12 mutation, which means mutation at 12th position of this protein, so this mutation could lead to a substitution of different amino acids. So glycine at 12th position can get mutated to aspartate, it can get mutated to valine, it can get mutated to cysteine, serine, and there are some other amino acids. But the prevalence or the percentage of these mutations are different. So most prevalent mutation at G12 position is aspartate. So the G12 get mutated to aspartate. It can also get mutated to cysteine or the valine. But also, if we talk about the percentage of the cysteine mutation or the aspartate mutation or the valine mutation, this is also it also varies based on which talking about. For example, If we talk about the lung cancer, you will see the cysteine mutation is most prevalent. What does that mean? The G12 get mutated to cysteine for most of the lung cancer in KRAS protein. Similarly, in the pancreatic cancer, the aspartate is the most prevalent mutation at G12 position. So these, and I would like to remember this chart because we'll talk about this in later slides. So let's talk about more about RAS protein in detail. So RAS protein is basically a molecular switch. What does that mean? Molecular switch means it's a protein which can be present either in inactive form or in active form. So when it's in inactive form, it's bound to GDP. So when the protein is bound to GDP, it's inactive. It's not working. It's not doing any signaling. But when this GDP get exchanged to GTP, so then protein becomes active. So GTP bound form protein is active, GDP bound form protein is inactive. And this inactive to active conformation change happens because of certain protein, as for example, the sauce. And when the protein is active in GDP bond form, which is on form, so this GTP bond form, once it's active, it can bind to its downstream molecules, downstream proteins. For example, the RAF protein. As you could see here, let me show you. So if you'll see, this is the signaling pathway. So the protein is inactive. Once the GDP get exchanged to GTP, protein become active, and it can activate downstream pathway. Either it's RAF-related pathway or it could be PI3-related pathway. But in either situation, the protein has to be bound to GTP. Once the activation of downstream molecule happens, the protein goes back to its inactive form by the GTP hydrolysis. What does that mean? The GTP becomes GDP, and that's how the protein becomes GDP bound form. Once the protein is GDP bound form, basically the protein is inactive. So that's the cycle through which the protein becomes active or inactive, and then regular downstream pathway. So coming forward to, so if you look at this diagram, you will realize that when the protein is inactive in GDP bond form, it will become active in GTP bond form. Once it's active, it regulate the downstream pathway, and because of that, it controls the cell growth, proliferation, migrations, all those kind of things in normal cells. But if the protein get mutated, as you could see here, the protein gets locked in GTP bond form. What does that mean? That the on form will be the most prevalent form. There will be continuous growth.
ले लो ये फोटो स्टेज की ले लो स्टेज की ले लो अभी खाली स्टेज है खाली ऑल सेट करो इसका भी तो बंदे बफरिंग आ गई भाई उसे देखो ये देखो पहले अभी बफरिंग आ गई नेट है क्या चेक करना गई ना नेट एक मिनट जूम की दिक्कत है या कि ना कनेक्टिंग की नेट ना गया नेट गया ना देखो भाई नेट नहीं आ रहा ये ना उड़ गया ये तो छोड़ बने नेट छोड़ गया ना वही तो कह रहा हूँ करो ब्लॉक ये वाला ऊपर करो ना ऊपर वाला एक रुको बस नेटवर्क सिक्योरिटी मांग रहा है छोड़ गए वाईफाई छोड़ गए बीच में कहीं ना कहीं थोड़ी बहुत
take you through the history of this last drug discovery. So it was discovered in 1980, and then later in 1980, people realized that it's a oncogene, which means cancer-causing gene, and then people discovered the signaling pathway of this protein in 1990, and around in 2000, animal models were developed for this protein. In 2010, people realized the protein-protein interaction, and in 2020, the drug was discovered for this protein. So it took almost 40 years to discover the drug. And today I'm going to tell you why it took 40 years, and then because how the protein which was really undruggable became druggable So I'll take you to that journey in a moment. So obviously, if you look at this timeline, this question will come in your mind that why it took almost 40 years to design a drug for this protein, and really important, a protein which causes almost 30% of the cancer. So there are two major reasons behind this. The first reason was that if you look at, so this is the RAS protein, right? As I mentioned, that it's bound to GDP or GTP, right? So one of the strategy for these kind of kinases or the protein GTPases or kinases is that you design a molecule which can compete with GTP. So if you design a molecule which will compete with GTP, which means the molecule will not let the GTP bind to the protein. So what will happen? So if GTP will not be able to bind the protein, obviously the protein will not become active. And if the protein cannot become active, it cannot activate downstream pathway and cannot lead to cancer. So that could be one of the very straightforward strategy, but uh, but it was not possible. The reason was the binding affinity of the GTP to the protein is extremely tight, which means GTP binds to the protein really tightly, and it's very difficult to design a competitive inhibitor. An inhibitor which can do competition with GTP, it's very difficult to design a competitive inhibitor. So the binding affinity is 20 picomolar for GTP. Now, if we talk about, just for a reference, if we talk about any other kinase, say for example the BRAF, which is downstream to KRAS, in the same signaling pathway, this protein was discovered in, like the mutation in the BRAF protein was discovered in 2002. And the drug, first FDA approved drug was approved for BRAF in 2011. So it took like 8 or 9 years, just 8 or 9 years to to design the approved drug. The reason was the binding affinity of ATP with the BRAF is just 20 micromolar. So imagine this is like 1 million fold difference in the binding affinity between ATP to BRAF and GTP to KRAS. And that's why it took almost 30-40 years to design a drug, because this strategy will not work for KRAS, unfortunately. So the other reason was that this protein, so to design a drug for any protein, you need an obvious pocket. So what does that mean? That if you look at the protein structure, normally they have some hydrophobic pocket where the small molecule can land and bind like this pocket. And when the small molecule can sit into the pocket, then it can interact with hydrophobic interactions, hydrogen bonds, and some other interactions. And because of those interactions, it will bring some changes, structural changes in the protein. And most of the time, those structural changes can affect the protein's activity. And that's how drug works, right? But unfortunately, if you look at the structure of KRAS protein, this is the structure of KRAS protein. The protein is very rock solid, and its surface is very smooth. So that's why there is no obvious pockets. If you'll see, there is no cavities or obvious pockets in the protein where you can land your small molecule to target this protein. And that's why this protein is considered undruggable, because you cannot land in a small molecule to the protein. You cannot. There is just one pocket where the GTP is binding, and but you cannot compete with that GTP as well. So there is no way you can target this protein, and that's why it was believed undruggable. And now I'll tell you how it became possible to target this protein in recent few years. So the breakthrough discovery happened in Kevin Socket lab. So his lab is in University of California, and he is the pioneer to design a drug against this undruggable protein. So what he did, so I'll tell you what he did and how he designed a molecule against KRAS protein. So I had shown you this slide before, that G12 position, which is the most prevalent position for the mutation in KRAS, can get mutated to the valine, cysteine, aspartate, and some other amino acids. So what he thought is that instead of going behind aspartate, which is most prevalent mutation, he thought that why can't we go against cysteine? So cysteine has a unique property that it can make a covalent bond with the small molecules. All other amino acids cannot make a covalent bond with the cysteine molecule, with the with any small molecule, it's steam can. A normally covalent bond is very strong bond and can induce a huge structural change in the protein. So, and there has been other covalent inhibitors which has been designed. One of the example is asparagine, which we take. So what happens is they thought that why can't we use that concept and design a molecule which will which will get attached to cysteine. So what does that mean? So he decided to just look for or design a molecule for just one particular mutation, which was G12C mutation, glycine to cysteine mutation at the position. So and the other advantage, so if you look at the structure, this is the structure of the protein. This is your GDP bound to the protein, and this is the G12 mutation in the protein, which causes. And if you see next to this G12, there is a very shallow pocket. We don't consider this as a pocket. This is very shallow pocket, but still there is some cavity, and they thought that probably we will be able to land our small molecule into this small pocket, and we can covalently link the small molecule to this G12C mutations. And so based on that, what he did is he screened around 500 small molecule which can covalently get linked to the cysteine, and they were finally able to identify 2 small molecules which were able to bind to G12C mutation. So just one thing to keep in your mind, that these molecules cannot bind to any other mutation, like aspartate and glutamate or any other mutation. It can only bind to cysteine mutations. So now if you see the KRAS, so both of these 2 drugs, they're able to bind KRAS G12C mutation. But so it was able to bind to the GDP bond form of the protein, but unfortunately these molecules were not able to bind to the GTP bond form of the protein. Now, why this is important? So imagine the GDP bond form protein is inactive form of the protein. GTP bond form is the active form of the protein. So what would be the obvious option to inhibit? What would you like to inhibit, the active form or inactive form? Obviously, you would like to inhibit the active form of the protein, because the active form of the protein is the consecutive, continuous signal to cause the cancer, right? So you would like to grab on or the inhibit the active form of the protein, not the one which is inactive, right? So unfortunately, this small molecule was not binding to the active form of the protein, but it was binding to the inactive form of the protein. So it was a big setback for the group, and they thought that probably on paper this molecule will bind to the protein, but in reality it will do nothing, because the G12C mutation will make the protein consecutively active in GTP bond form, and this drug will never bind to the protein because the protein is in GTP bond form. But when they saw the structure, they realized that this is the small molecule. There was no cavity, no obvious pocket, but this small molecule was able to make a cysteine ligation. You could see covalent ligation with the cysteine, and then it was able to induce the pocket. It was able to create the pocket where this molecule was able to fit in or bind. And this is the GDP bond form structure. Now, one thing, but fortunately, what they realized that even if it binds to the GDP bond form protein, somehow the small molecule is able to lock the protein in GDP bond form. That means that once you put the small molecule to the protein will be stuck in GDP bond form configuration, which means it will not be able to go back to GDP form configuration, which means the protein will not become consecutively active. So obviously the population of GDP bond form protein is very small, but whatever population we have in GDP bond form protein, that will never go back to GDP bond form protein. The G12C mutation, by naturally, some of the molecule in GDP bond form can go back to GDP. So whenever any GDP bond form protein will go back to GDP, the molecule will grab it. And it will grab it and will freeze the molecule in GDP bond form and will never let it go back to its active form. And that's how this molecule was able to inhibit the tumor formation. So this was the kind of first very specific targeted small molecule for any of the KRAS mutations which was discovered. And then, based on the discovery of this small molecule, then there was 2 different companies who took these scaffold and then further did modifications to the scaffold to make a drug-like molecule, because many of the time you will design a molecule which will have a strong binding, but it will not be a good drug because it has to have drug-like property. Like, when you take it into your body, it should not have a lot of toxic effect. It should be more soluble in the water and all those kind of things. So they took this small molecule, which was G12C inhibitor, and then they modified it in such a way that they could develop a drug. So the first company who were able to develop a drug, this small molecule was Amgen, and it developed a drug called Amgen. Amgen 510 became the first FDA-approved drug against KRAS. So this was a huge news, and it was a huge, discovery, because finally, after 40 years of effort, there was one first targeted drug against KRAS protein. But one thing to remind you that this drug was against just one mutation, which was the G12C mutation. So if the patient have G12C mutation, this drug will work. But if the patient have any other mutation, this drug will not work. So this drug will not work, obviously. But there is one advantage also of this drug, that this drug cannot bind to wild type protein. Hello? I, Let me just, I think I'm getting called.
जब सबकी ले लो तो बता देंगे वहाँ पहुँच सकते हैं ठीक है थोड़ी सी चीज दिखा दूँ थोड़ा व्यू दिखा दूँ
हाँ सर, आवाज नहीं आ रही है क्या?
बोलना आशीष भाई
हेलो
आशीष भाई
हाँ सर
यस सर
okay 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 sure. So yeah, so coming to the so this is the another company which also developed the same drug, and then finally there was, based on this drug, there was a lot of new drug which was discovered, not only for G12C but also for G12D and other mutations. And this brings a lot of excitement in this drug discovery field. And if we talk about the work we do, we also have designed a small molecule, but not in the same pocket. We identified a different pocket, and we identified a new molecule which binds into this new pocket and can also inhibit the protein. So with that, I would like to thank my lab, Campbell Lab, Sharon Campbell, who is my PI, and also would like to thank Mirati Therapeutics, Amgen, and SOCAR for helping with this PPT. With that, I would like to take any question if you have. Thank you so much.
Thank you, sir. Thank you for this enlightening session. It would be very helpful for us students.
Yep. So let me know if there is any question.
Reed, sir, would you like to ask some questions?
We will mail you, then we will get back to you.
Okay, thank you so much.
No, thank you,
I
sir.
appreciate
Thank
your
you.
time. Thank you.
Bye.
All the faculty members. All the faculty members and students are requested to please report to the stage area. We are starting our event and the chief guests are arriving soon. So please all are requested to come to the stage area. You all are requested to please stand up to honor our chief guest. Today marks the commencement of an event that promises to be both enlightening and enriching as we gather here to delve into the depths of Industry 4.0. It's my great pleasure to extend a warm welcome to all of you to MVN University's second international conference on campus to corporate Industry 4.0. So ladies and gentlemen, esteemed guests and respected dignitaries, I kindly request your attention as we begin today's auspicious ceremony with the invocation of Goddess Saraswati and the ceremonial lighting of the lamp. Let us all join together in this moment of reverence and enlightenment.
विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा सरस्वती नमस्तुभ्यं वरदे कामरूपिणी विद्यारम्भं करिष्यामि सिद्धिर्भवतु मे सदा
It is now my pleasure to invite our distinguished dignitaries to the dais. Please join me in extending a warm and heartfelt welcome to Dr. Pramod Dattaji, Managing Director, Systopic Labs. Please have a big round of applause.
Please do not call me a doctor.
Dr. N.K. Pandey, Chairman and Managing Director, Asian Hospital.
Please give a huge round of applause, everyone.
Mr. Dhanesh Adlakha, President, Haryana State Pharmacy Council. Dr. Vijay Bhalla, distinguished guest, Principal, SDT University and General Secretary of IPGA. Dr. G. J. Balan, Dr. Naseeb Singh Gill, Professor, MD, University Rohtak. Shri Sanjay Gakar, Vice President, Multi-Commodity Exchange of India. Professor Dr. Arun Garg, Honorable Vice Chancellor, MVN University. Professor Dr. N.P. Singh, Honorable Pro Vice Chancellor, MVN University.
And Dr. Rajiv Ratan, sir, Registrar, MVN University. Please come on the dais, sir. Today, we embark on a journey that promises to illuminate the intersection of academia and industry, navigating the transformative landscape of Industry 4.0 in the era defined by rapid technological advancement and unprecedented connectivity. The transition from campus to corporate has never been more profound. This conference serves as a platform for us to explore the evolving demands of the modern workforce. We are thrilled to see such diverse and enthusiastic group gathered here today. We welcome all of you, sir. Now, it's my pleasure to invite our distinguished dignitaries and Honorable Vice Chancellor, Sir Dr. Arun Garg, to welcome our chief guest.
I request Professor Dr. Arun Garg, Honorable Vice Chancellor of MVN University, to please welcome Dr. Pramod Datta, Managing Director, Systopic Labs.
Everyone, please have a huge round of applause for our chief guest.
Now I request Dr. N.P. Singh, sir, Pro Vice Chancellor of MVN University, to please welcome our guest of honor, Dr. N.K. Pandey, Chairman and Managing Director of Asian Hospital. Let's please have a huge round of applause for Dr. N.K. Pandey. Now, I would like to request Dr. Tarun Virmani, Dean of Pharmaceutical Sciences, MVN University, to please welcome our special guest, Dr. Naseeb Singh Gill, Professor, MD, University, Rohtak. Have a huge round of applause for Dr. Naseeb Singh Gill. Everyone, please have a huge round of applause. Now, I request Yogendra Singh, sir, Dean Academics, MVN University, to please welcome our distinguished guest of the day, Dr. Vijay Bhalla.
Next, I would like to invite Dr. Mayank Chaturvedi to welcome our special guest, Shri Sanjay Gakhar, Vice President, Multi-Commodity Exchange of India. I request Mayank Chaturvedi, sir, to please report to the stage area.
Everyone, please have a huge round of applause. Now, I would like to request Dr. Rahul Varshne, Dean of School of Law, MVN University, to please welcome our guest of honor, Dr. G. Jaybalan Ji. Everyone, please have a huge round of applause for Dr. G. Jaybalan. Now, I would like to request Dr. Yogendra Singh, Dean Academics, MVN University, to please welcome our distinguished guest, Dr. Devendra Pathak. I request Dr. Devendra Pathak to please come on the dais. Everyone, please have a huge round of applause for Dr. Devendra Pathak. He is Director of Rajiv Academy for Pharmacy, Mathura, having a huge experience over 33 years and counting many more. for Dr. Devendra Parak, sir.
Next, I would like to request Shri Bhanu Dua to please come to the stage area, and I request Dr. Vineet Kumar to please welcome him.
Now, I request Miss Rashi Singh to please come on the stage. I request Dr. Sika to please come on the stage area. Everyone, please have a huge round of applause for Dr. Seema Sika. I would request Miss Rashi Singh to please welcome Dr. Seema Sika.
Please accept these floral tributes as a token of our gratitude and respect. Now, it's my privilege to introduce a visionary leader, Professor Dr. Arun Garg, Vice Chancellor, MVN University. Professor Garg has been associated with quality pharmacy education as an academician for the past 37 years. He served as Professor and Dean at the School of Medical and Allied Sciences, K.R. Mangalam University, Gurgaon. His research areas of interest are drug utilization studies, quality of life studies, rational use of drugs, hepatotoxicity, liver regeneration, diabetes, etc. His research on hepatotoxicity and liver generation was recognized by the Indian Pharmacological Society and was awarded Dr. B. Mukherjee Award for the best paper in the Indian Journal of Pharmacology. Further, he was also conferred with Hamdard National Foundation Research Award for his research on Sankara, and he also bagged the Gold Medal Award for standing first position in M Pharmacology at the university, and also a recipient of the prestigious Young Teacher Award by the Society of Pharmaceutical Education and Research. Respected sir, I welcome you to please address the gathering. Please have a huge round of applause for our Vice Chancellor, sir.
Good morning to all of you. Good morning to all of you. Good morning. Esteemed guests, distinguished delegates, respected faculty member, and my dear students and participants. I welcome you to the MVN University, and first of all, I thank my management for support and confidence in me. Also thanks to all my staff members, my students who are doing constant work from the past one month to see and witness this multidisciplinary Science International Conference Campus to Corporate Industry 4.0. It gives me joy to witness the gathering of brilliant minds and industry stalwart under one roof as we collectively embark on the journey to bridge the gap between academia and corporate. Our theme, Campus to Corporate 4.0, is not just a mere phase, but profound mission that encapsulates the essence of our endeavors. In today's rapidly evolving landscape, the transition from educational institutional to professional setting has become increasingly crucial. As we stand at the threshold of Industry 4.0, characterized by digital transformation and technological advancement, it becomes imperative for us to synchronize and realms of the academia and industry seemingly. I am deeply honored to welcome our esteemed guest who, along with them, brings a lot of wealth of experience, expertise, insights. We are privileged to have Dr. Pramod Datta, Managing Director of Cystopic Laboratories, and he has been our guide and mentor from the past 25 years and always supports me and Indian Pharmacy Graduate Association with full heart. I am also really thankful to Dr. N.K. Pandey, Chairman and Managing Director, Asian Hospitals, for sparing the time. It is only with 2 days prior that we came to know that Dr. Pandey is also willing to join us in this endeavor. I'm also thankful to Dr. Naseeb Singh Gill, Professor and MD University Rohtak, Sanjay Khakar, Vice President Multi Commodity Exchange, and my friends, panelists. I would like to bring to you our achievements. I'm going to complete my 1 year on 16th of March, and we have done approximately 20 MOUs, and some of them are Sarvodaya Hospital, Faridabad, National Bureau of Plant Genomics Resources, ICA, IARI, PUSA, CFC Pharma Clusters Private Limited, state-of-the-art laboratory at Karnal, and several other hospitals and pharmaceutical companies and other. To name a few achievements, this year we did 750 admissions with approximately 58 foreign admissions. Now we are pursuing with 75 PhD program, PhD candidate, and we are starting our new hostel, admission block, training and placement cell, and this amphitheater is also being started and renovated this year. I believe in learned and experienced faculty who can guide us and lead our courses. And some of them are with you. Professor N.K. Ahuja has been blessing us with his knowledge in regulatory affairs. Professor Dr. Ansari, who has been the Vice Chancellor. Professor Subhash Gupta, he has not come today. He is PhD in Management and Law from Delhi University, gold medalist. Mr. Manas Ranjan from Cognitrex. And I would like to say that we have improved in academics We are doing better in results, industrial training, more postgraduate programs. We are starting up with MPharm in regulatory affairs and MPharm in pharmacology, along with PharmD courses. We have published more than 150 papers and we have around 5 to 8 patents. We have recently completed successful cultural festival with more than 25 to 30 colleges participating in that. And we have won several prizes in the sports. These are few of our achievements. I don't take much time. I once again welcome all of you, my esteemed guest, chief guest, Dattaji, Ahujaji, and others. Thank you so much.
Thank you, sir. Now, I would like to introduce our conference chair, Professor Dr. N.P. Singh. Dr. N.P. Singh is Dean and Pro Vice Chancellor at MVNU University. He received his MSc from CCS, Meerut University, Meerut, India. MS from Birla Institute of Technology and Sciences, Pilani, India. And PhD from CCS Haryana Agriculture University, Hisar, India. His areas of interest are qualitative analysis, optimization models, research methodology, information technology management, telecom policy and management, business intelligence, enterprise system, data mining, and analytics in marketing management, HR, and finance. He has published more than 100 research papers, guided 10 research scholars for their PhD work. In addition, he had supervised more than 400 master and MPhil thesis research of master's student. He had worked as consultant on 50 plus consulting assignments for the organizations such as Asian Development Bank, World Bank, Government of Sri Lanka. I request you, sir, to deliver a conference note. Everyone, please have a huge round of applause for Dr. N.P. Singh.
Good morning to all of you. Honored dignitaries on the dais, my faculty colleagues from the MVN University and other institutions of this region, students of MVN University and other institutions, staff members of the MVN University, ladies and gentlemen. Thank you so much for taking the time to join us today. We truly appreciate your presence. We are honored to have such esteemed experts in their own domain on the dais today, and they will be sharing their insight with us today. It's my honor and privilege to welcome you all to this multidisciplinary conference, where minds from the various fields converge to explore, innovate, and collaborate. As the chair of this conference on the theme of the Campus to Corporate Industry 4.0, I stand before you with a profound sense of excitement and anticipation for rich exchange of the ideas that lies ahead. As we navigate the ever-changing landscape of the modern education and professional development, the transition from the campus to corporate has never been more crucial or complex. In the era of the Industry 4.0, characterized by the convergence of the digital technologies, automation, and data exchange, the skills and competencies required in the workplace are evolving at an unprecedented rate. The journey from the campus to corporate in the context of the Industry 4.0 demands more than just academic knowledge. It requires adaptability, agility, and a mindset geared towards the continuous learning and innovation. As students and aspiring professionals, it is imperative that we not only acquire the technical skills, but also cultivate a holistic understanding of the digital ecosystem of economies, specifically the Government of India and its constituents, and its implications for the various industries. And I'm sure that this conference is going to serve that purpose. In addition to that, the bridging the gap between academia and the industry is essential to ensure that the graduates are equipped with the practical skills and the real world experience needed to thrive in the today's dynamic job market. This necessitates closer collaboration between the educational institutions and the industry partners, as well as the integration of the experience learning opportunities, such as internship and the industry-sponsored projects in the curriculum. Education system is certainly progressing with the Industry 4.0, with its paradigm change in the form of the Education 4.0. Unlike its predecessors, Education 4.0 is characterized by the integration of the cutting-edge technologies such as artificial intelligence, augmented reality, and the big data analytics to enhance the effectiveness and accessibility of the education. The core of Education 4.0 seeks to personalize learnings, catering to the individual needs, preferences, and learning style of each student. Though adaptive learning platforms and personalized learning pathways, students can engage with educational content in a way that is tailored to their unique strengths, weaknesses, and interests, fostering deeper understanding and mastery of their subject. Another important dimension of the Education 4.0 and the Industry 4.0 is the challenges of understanding its complex interconnectivity. We cannot afford to remain siloed within our respective discipline. Instead, it is imperative that we embrace the multidisciplinary approach, drawing upon diverse perspectives and expertise to tackle the multifaceted issues of the Industry 4.0 and having it connect with Education 4.0. Today, we are gathered here as a representative of the different fields such as engineering and technology, pharmacy, law, business management and commerce, allied health, agriculture, social sciences, in the form of the scientists, researchers, scholars, practitioners, and innovators. United by the common purpose to explore the intersection of our disciplines and harness the power of collaboration to drive the positive change. Throughout the course of the conference, approximately 350 pieces of research ideas in different subjects will be presented by the faculty and the research scholars, students of the master's and the graduate program from the different universities and institutions from this region. And I'm sure this platform in the form of the second international multidisciplinary conference will achieve its objective of facilitation of thorough, thought-provoking discussions, exchange insights, and forge new partnership that goes beyond the traditional boundaries. From cutting-edge research to innovative solutions, each presentation and interaction hold the potential to spark new ideas and catalyze transformative breakthrough within its own domain. As we embark on this journey together, let us approach each session with an open mind and a spirit of the curiosity. Let us embrace the diversity of the perspective in our midst and seek out opportunities for cross-pollination and synergies. And let us remain steadfast in our commitment in advancing knowledge, promoting dialogues, and fostering collaboration across disciplines. Once again, I thank you for your participation, and I wish you all a productive and enriching experience at this multidisciplinary conference. I also thank the management of the MVN University, faculty colleagues of MVN University and other institutions, administrative staff, and students of the MVN University and other institutions for their contribution and taking the process to this amphitheater. Jai Hind. Thank you.
Thank you, sir, for your valuable words. Now, I would like to introduce our guest of honor, Dr. N.K. Pandey, Chairman and Managing Director, Asian Hospital. Dr. N.K. Pandey is an eminent surgeon and a committed Indian foremost. He has left an indelible mark in the field of healthcare in India. Through his long and illustrious career spanning over 3 decades plus, he has single-mindedly dedicated his life to making healthcare affordable and accessible to all the Indians. For his pioneering work in the space of laparoscopic surgery, Dr. Pandey was awarded the prestigious Dr. B.C. Roy National Award in the year 2005 and Padma Shri also in the year 2014. Please have a big round of applause, everyone. He was awarded Padma Shri in the year 2014 for his outstanding contribution in healthcare. Now, I would like to request Dr. N.K. Pandey sir to address the gathering.
Good morning, respected Vice Chancellor Arun Goyal, Pro Vice Chancellor
आ जाएगा नहीं आ जाएगा
young man who is sitting across me. I would like to first of all pay my respectful regard to Pandit Gopal Sharma, who was a very dear friend of mine. And when I come here and see this university, I can understand that what kind of seed he has planted, that you are sitting under that tree. So my big regards to Pandit Gopal Sharma ji. Wherever he is, I send my prayers to him. When I was coming here, I was not sure what is the purpose of me coming here. I am in midst of so many knowledgeable professors sitting here, so it becomes very difficult to speak something amongst them. So I'll try to limit myself to my own field, and I would like to limit to what I do. I'll basically take you through many stories that I would like to share. And I'm no text prepared, so I hope that I'll keep you focused. So when you read medicine, medicine is not new. Only the medicine is changing. And medicine is changing. If you look at it, I can simply put it in word of, if I put it for surgery, surgery is only two things, combination of two things. One, what you see, and second, what you do with your hand. So if you simplify it, it's only this. And all the changes that has come in surgery is based on these two fundamental points. That what you see, and what we see today has totally changed. There was time that I will look with my naked eye and see whatever I want to see. Today we have microscope, we have way to see the things in different pattern. And then we have to analyze what we are doing. And how we do it, the hand movement has changed. So today I use robotic, where I sit on a chair. So if I'm doing a 5-hour surgery, I'm not standing, I'm not sweating. I'm comfortably sitting on the chair and I'm giving direction to the computer with my hand like you play video games. And this is being accentuated on the patient and the deal is being done. And there are many areas which is inaccessible to us. Like when you are operating in the chest, you can hardly see anything at all. It is all on feel and gut. Somebody is holding the retractor and pulling it apart. Jaise Hanuman ji ka sina phar rahe ho. Nothing like that today. We have best of the SD camera that goes inside, very small one, even thinner than my fingers. And we have instrument that we can bend it in many places and still it will listen to my command. My wrist movement are transferred by the computer, so our wrist movement is incomplete. I can't move more than 45 degrees. But when you start working with the robotic, the movement can go to 360 degrees. The computer, you take the instrument wherever you want to take and leave it there, it will stay there. Next round of movement, if I can do 45-degree movement, it will come to 90 degree and it will keep on increasing. So these are the two basic changes that has happened. And this will keep on happening. But you know, as a surgeon, if you look at the history, in prehistoric days, we have found a skull that has been carbon dated, where a hole is made in the skull. So people at that time, I'm talking before Dhanvantari, they thought that you can drill a hole in your brain and you can make things better. So neurology was practiced not today, even 3,000 years before. The only thing is we are more precise, we are more focused, and we are less barbaric. So surgeons are getting barbaric because when you are operating, there is blood loss, there is tissue damage. You are going more and more precise. And it will keep on changing like that. So why I am sharing this to you? Because I gather that in this audience are future engineers, they are sitting, computer engineers, they are sitting, and of course there are big people from pharmacology, so I'll come to that later on. Engineering students are sitting. During my training, I worked at Aberdeen University, very closely associated with the Royal College of Surgeons of Edinburgh, and in its campus, it has a lab where you can go and devise your own instruments. So I would like to invite a situation that in my hospital, I have a section of lab that where a couple of you can come and help me design my own instruments. So that is what my focus is. We'll miniaturize the instrument. So when 30 years ago I was doing abdominal surgery, we will open the whole abdomen. Today we make tiny holes. That day is not far. That even robotic that we are practicing today, laparoscopic that we are practicing today, it will be deemed to be very barbaric. Eye surgery is one surgery. We think that it is bloodless surgery. But when you make an incision in the eye to remove the old cataract and put in the new lens, we damage trillions of cells. So to surgeons to become less barbaric, we have a long distance to travel, and we need all of you to give your input, work with us, work with the future surgeon, and devise the means to make it less painful, very early return to work. I can see that swift change happening in my own career. But future of surgery is not that. Future of surgery is dimmed. A day will come that we don't require surgeons at all. In case of, only you need it in case of accident and cosmetic surgery. Because today's research are changing the total scenario. If you look at the people who are working on aging, aging is a very major problem surgically as we see. Your heart attack, because your coronary artery has become harder. Why? The protein has become very tight. Protein has aged. We have cataract because protein of the eye has become harder. We get prostate enlargement. Female gets uterine problems. It is all linked with aging. So if we can cut out the aging, then perhaps we will live for 300 years. But then it will bring different philosophical issues that if you live for 300 years, what will happen to population? Where we will have a space. And I think it is a future problem that will be addressed as the time comes. But medicine is changing. Today, we have chairman, managing director of Cystopic. So particularly, I would like to point out to him that when we write medicine, we write 500 milligram, half gram. We write 10 milligram. We don't require it. It's all wastage. So what we need to do is to find that where is the seat of infection, where we require antibiotic, where we require the medicine for blood pressure to act in the brain or the heart. And you deliver it there in the minutest of the quantity. And that is personalized medicine. So medicine will not be general. Medicine will be made for Dr. Garg or Mr. Singh or Ahuja Saab and delivered particularly for him. The whole healthcare will change. Then we will be talking in terms of microgram and will not talk in terms of complication of medicine. We'll be delivering it in micrograms effectively on the site that is required. We have not reached there. It will take some time, but we are going to reach there. What is happening of IT in our hospital? you will find that total your journey in any modern hospital is tracked by IT. A time is come, if you think of medical student today, he has done MBBS, what you would like to do? The first preference will be radiology. Because you can set up your own ultrasound, you are on your own. Friends, that time is going to disappear. Deep learning and AI solutions are going to change the total thinking. Already Boston, if you look at Boston Harvard Medical School, they don't use first-line radiologists to report CT scan MRI. The moment they do the imaging, the computer will compare millions of similar images and will give you a diagnosis. So only when there is a dilemma, the radiologist will interfere. So in time to come, radiologists may not be required. They will disappear. So medicine is gradually going to change. I would like to take you to a district called Greifswald in northern Germany. It is a not densely populated area, and delivering a curative care, therapeutic care, means doing a surgery or sending a doctor or treating you, is so expensive. And they want to introduce corrective measure before disease has actually started. And this is driven not by me. They are using experimental 7 Tesla MRI to see how the molecular changes are happening. And they would like to treat that molecular change when it is happening in the body, that it doesn't progress to a disease. So if the tumor is going to discuss, they are going to take action, because actually any change is happening in first cell. And that, I think, will be the game changer for human being. Then, perhaps as a doctor, I will be paid if I keep the population of Hodal and Palwal healthy. I'll not be paid for doing a surgery. So that is what's going to happen. It is going to move to totally preventive medicine. And not only that, earlier, if we are doing a drug trial or research, it will take a lot of time. We were just talking about COVID vaccination, how quickly it emerged from India. And it was because of biochemical engineers that we have, the computer setup that we have, that they could quickly duplicate the COVID virus and find antibodies and bring out the vaccine. So the future computer engineers are going to have greater role to play than a physician or surgeon. So that is how medicine is going to change. Not only that, when we talk of corporate to campus to corporate, healthcare is 5th largest employer in the country today. And with 43% unemployment, you guys have to think laterally. The only job that is not available, is not the government job. I run 5 hospitals, 1 large and 4 are medium size. I employ 3,500 people. And only around 300 are the doctor and 700 are nurses. But hospital requires you. It requires a computer engineer. It requires a mechanical engineer. It requires all kind of people. It requires people who can analyze the data. It requires people who can do the billing. So when you are looking at profession, when you are looking for migration from your campus to a corporate, you have so many options. The only thing is that you have to give a more wider look. You have to prepare yourself for that. And what we are looking for is your integrity, your timekeeping, the way you conduct yourself in the setup, your behavior, your integration with the main work. So unemployment, when we talk of, I'm not proposing that you sell pakoras, but what I'm saying that there are so many options if you work laterally. It's not only that, how many big engineers of IIT do engineering? Very few. Most of them, if they are employed in India, they move to marketing. They will be working for Hindustan Liver and selling soap. So you have to think in different way. So healthcare is one of the options for you, and healthcare is fifth largest employer of our country. So give them a trial. And I promise to you, Vice Chancellor, that if there is anything that he wants to do with us, we have set up programs for you. We would like to get integrated with you. You can have batches of you to come visiting hospital. We can show you back room operation. We can give you access to front room operation. We would like to make you feel how good place hospital is to work. Sometimes it is sad as well, but because if birth takes place in the hospital, death also takes place in the hospital. So we sensitize you to both. And I personally find that working in healthcare is such a great pleasure. You look after from grandchild to grandfather, and in between everybody. And you are associated with the family in your good time, in your bad time. So there is a childbirth, you get laddus. If there is somebody who lifts you from this world, then you have to hold their hand. So you are in sadness and good time you are associated when you take option of working in healthcare. And then various research research opportunity. There are opportunity to interact with community. So when you are exercising your option, just look beyond IT company. Just look beyond selling something for Amazon. There are so many things where you can work and peacefully. It's not that you are only doing night shift for an American or a British or a French company. So my message to you is simply that when you are in the university, put your hard work to your education, put your heart and soul to what is being taught, because that's going to be really the main board that will be used in the future. And come to us, we'll tune your software. We'll make you good to work with any place that you go to. That's my promise. I wish you all the best. I do not wish to take more time. I would sincerely like to thank the management of MVN for having invited me. And I apologize for any inadequacy that I have left behind during my talk. Thank you very much.
Thank you, sir. Thank you for your words of wisdom. So we are very close to the souvenir release, but before that, Professor of Practice, Dr. Subhash Gupta ji just joined us. So I would like to request our registrar, sir, Dr. Rajiv Ratan, to please welcome Dr. Subhash Gupta ji. I request Dr. Subhash Gupta to please come on the stage area. Now, I would like to invite Shri Narendra Ahuja sir on stage area. I request Dr. Rajiv Ratan to please welcome Shri Narendra Ahuja. Now I request Shri Ansari sir to please come on the stage area, and I request Dr. Rajiv Ratan to please welcome him. Everyone, please have a huge round of applause. Thank you, everyone. Now, it is time to release the souvenir. I request all the dignitaries present here today to please release the souvenir. Everyone, please have a huge round of applause. I request Dr. Vineet to please come on the stage. I request Dr. Jayamanti Pandit to please come on the stage. I request Dean Academics, Dr. Yoginder sir.
Now, I would like to introduce a guest of honor, Dr. Atul Nasam. He will join us online. Dr. Atul Nasam works as a Pro-Vice Chancellor at SDT University, Gurugram, Haryana. Earlier, he worked as the head of the Office Controlling and Licensing Authority and Deputy Drugs Controller with Drugs Control Department, Government of NCT of Delhi. He is a member of various committees constituted by the Government of India, Government of Delhi, and Pharmacy Council of India for framing different policies. Dr. Nasa is a doctorate in pharmaceutical sciences from Amity University and postgraduate in pharmacy from Delhi University. He has over 35 years of professional experience in different fields, including industry, academics, and regulations. He is a member of the Drugs Consultative Committee. Dr. Nasa was also nominated as a Pharmacy Council of India member of the Pharmacy Act by the Government of NCT of Delhi. Let's welcome him with a huge round of applause.
Good morning. I'm audible?
Yes, sir.
Hello?
You are audible, sir.
Namaskar, sir.
Sir, you are audible and visible, sir. You can continue.
Can we start?
Yes, sir. Please.
Okay, thank you. Very good morning to all of you. And at the outset, I am extremely very sorry for not joining physically to this one of the very important event of international conference organized by MVNU University at Palwal. Due to some my official commitments, I was not able to join and come physically for this conference. But my heartiest congratulations to my friend Dr. Arun Garg, the Vice Chancellor of MVN University, and all other respected dignitaries who have spared their valuable time to attend this conference and grace this auspicious occasion. The theme of this conference, that is corporate to industry, is well chosen, particularly for all the pharma students attending this conference. As we know, India is the pharmacy of the world. We are exporting a number of formulations, including vaccines, to the entire world. And pharmaceutical profession or pharmacy profession is one of the best noble profession in the healthcare system. Pharmacists working in different spheres of pharmaceutical profession, maybe pharmaceutical industry, research and development, quality control, quality assurance, hospital pharmacy, community pharmacy, clinical pharmacy, regulations, clinical research organizations, academics, and so on play a very important and vital role in healthcare system. But taking theme into consideration, there is a need that there should be a complete skill development for all the graduates. They must be trained in automation, in machine learning, in digital literacy, etc. They should be very strong in interdisciplinary language knowledge, and this is very helpful for their future and growth. They should be taught for awareness of industry trends, what the industry want from them, and that is the future of the pharmaceutical industry. There should be the ethical consideration for all the graduate pharmacists, and there should be a continuous learning process for all the graduate pharmacists. We can reduce the gap between in the industry and academia by conducting several programs, by tie-up with the concerned related industry, maybe pharmaceutical industry, maybe medical devices industry, maybe diagnostic industry, maybe cosmetic industry, and so on. With these remarks, I will not take much time, and my best wishes to all the young students who are attending this conference, and my heartiest congratulations to Dr. Arundar, Dr. Ahuja, and the entire faculty of MVN University for conducting this international conference. Thank you very much.
Thank you, sir. Thank you for your words of wisdom. Next, I would like to invite on the stage our guest of honor, Dr. G. Jaywalan, ex-Dean RUHS, Jaipur, and Principal, Alwar Pharmacy College, Alwar. So please come on the stage. Everyone, please have a huge round of applause for Dr. G. Jaywalan. Dr. G. Jaywalan, he was awarded by APP Principal of the Year 2013, IPGA Fellowship Award 2018. He has reached on the stage. Everyone, please have a huge round of applause again.
Very good morning, respected dignitaries on the dais, of the dais, my dear teacher colleagues, and my dear students. In this morning, we all gathered here for inaugurating the conference on Campus 2, Corporate Industry 4. I'm sorry. And yesterday, I visited one marble sculpture making unit of Alwar, where they were making marble murtis of divine sculptures. I watched them for some time. What we are doing in academic institutions and universities are more or less similar. We are getting very good, fine, white marbles as stones. Here, the academic institutions play a vital role in removing some unnecessary parts from the stone and bringing out very good sculpture which is hidden inside of the stone, marble stone. We teachers also doing the same thing. We are very, very strict sometimes in removing certain unwanted parts from the students and making them ready for the corporate industry, which is expecting what the student to be, what a scholar to be, or what a graduate to be. So the academic institutions and universities are doing this, making of the students ready for the workplace, the industry in which they are going to work. So sometimes we may need some fine tuning also, like making the murti smooth and polished, nice. We may need some extra rubbing over the stone sculptures. Like that, only the conferences help the student to make them fine-tuned and finely finished for their industry life, for their career. So attending a conference is not just for meeting the friends and talking for some time and moving out. It is for learning something new from the people who are coming around, coming from other places. You are out of the regular teaching in colleges. You are seeing some new faces, new teachers. Many experienced people are coming and delivering talks for you to make you to aware of the latest technologies and the opportunities that are available for you after completing the graduation. So the academic institutions which are conducting the conference like this are doing some fine tuning in making the beautiful sculptures of students who are ready for the industry, which is the campus corporate industry 4.0. So what are the aspects and what the things are to be taken care by the students and teachers for today will be deliberated in this conference by different eminent speakers. So please, all of you, my dear students and teachers, attend all the sessions and get the take-homes from the speakers and utilize it for your bright future. So with this, I would like to say sorry and for coming a minute late, and thank you for calling me and standing me in front of you and delivering a talk in the inauguration of this conference. Thank you, all of you. Especially, I thank the management of MVNU University and the Vice Chancellor, Dr. Arun Garg, who is the General Secretary of IPGA, Delhi. Thank you very much, sir. Thank you, all of you. Thank you.
Thank you so much, sir. Now, I would like to request our guest of honor, Dr. Naseeb Singh Gill. Dr. Naseeb Singh Gill is the senior most professor in head Department of Computer Science and Applications, MD University, Rohtak, with 34 years of overall experience in working since inception of the department. And he is currently working as a director, Center for Distance and Online Education, director of Digital Learning Center, and nodal officer of Academic Bank of Credits, MD University, Rohtak, Haryana. He is also the recipient of the Commonwealth Fellowship Award of British Government for the year 2001, recipient of the Best Paper Award by Computer Society of India, and Best Paper Presentation Award in International Conference on Information Systems and Data Mining. I welcome you, sir.
Esteemed luminaries on the dais, first of all, I would like to thank the Vice Chancellor of MVNU University, Dr. Arun Garg ji, Pro Vice Chancellor and my mentor, Professor N.P. Singh ji, the chief guest of this second international conference, Dr. Pramod Datta ji,
all other distinguished guests of honors, of the dais, learned entrepreneurs, industries, pharmaceutical communities, and all stakeholders of MVN University. Indeed, I am blessed to be part of this wonderful August gathering as a part of this inaugural session. And I've been listening very patiently all our learned speakers. Being a student of computer science and technology, when I'm just looking at the theme of the international conference, that is Campus to Corporate Industry 4.0, as a man of technology, it appears to be very challenging and difficult for me to justify my role. And what it reminds me, it just motivates me to share one of the couplets of a Urdu shair, because what extent I should cover as a part of my talk and what I should skip. And those lines are, सकूने दिल से एतमाम तो करूं, जरा नजर उनसे मिले सलाम तो करूं, मुझे तो होश नहीं मशवरा दीजिए, ये फसाना कहां शुरू कहां तमाम करूं. If you are talking about like what Professor N.P. Singh sir was sharing here, that the technological innovations and their role, and well supplemented by Dr. Pandey, it also indeed motivates me to go for certain good sharing with you. But being an academician researcher, first of all, I would like to share with you the landscape of higher education in India today. We are having, as on date, 1113 universities. And we are having close to 56,000 colleges which are catering to the needs of higher education in India. And if you are talking about the total enrollment, that's about 26% for our higher education. And we are talking about graduates, total percentage, that is approximately 9% only. We are the second largest country in the world after United States, where we are having approximate 41.3 million students pursuing higher education. And of course, one of the famous couplets of the great motivator, APJ Abdul Kalam ji, what he says, learning gives creativity. Creativity motivates you to think. Thinking leads to knowledge, and knowledge makes you great. This is how beautifully from learning to knowledge. And here is the foundation of our innovation. If you are talking about how we are progressing in terms of our digital universe, let me share with you friends, 5 years before, the common needs of the data, average data per day for an individual, it used to be 1.5 GB per day. As on date, it's running between 4.5 to 5 GB per day. And I think it is enough to help you think that what is the role of our digitalization and our innovations and the technologies in our day-to-day processes. When we are referring our industry 4.0, along with, in its sync with is what also education 4.0. What exactly is mandated by National Education Policy 2020 which is offering a wonderful flexibility to the stakeholders to go for 40% of the courses through MOOCs and well motivates for personalized learning. And as per the mandate of NEP 2020, it particularly is aiming to lay foundation for what? The knowledge and the creativity, and which indeed would help inculcate our innovation capabilities among our students. I'm just referring to one of the statements made by co-founder of Apple in the year 2018, Steve Wozniak. Steve Wozniak said, in India, where is the creativity? What he said, that in India, people go for education, get a good job. There is no creativity. There is hardly any creativity. And again, if you talk about Satya Nadella, Sundar Pichai, there are a lot of controversy that dragged him. But friends, let me share with you certain statistics today. I think that will also make us feel that what he said was right. Today, the world population goes 8.08 billion. If we are talking about the share of only the two countries, India and China, today, our population is slightly larger than China. And it forms about 35.6% of the world population we both countries are sharing. And I am just now sharing statistics of the biggest prizes where people consider that as the major for innovation, and that is the Nobel Prizes. See, since its foundation in the 1897, and when our Nobel Prizes were started in the year 1901, total 965 Nobel Prizes have been given. And to China and India backed 12 Nobel Prizes, even including the scientists which are having dual citizenship. 8 China. And a country like the United States, which is having lesser than 1/4 of the population, which backed around 393 Nobel Prizes. So it means population share is 35.6% and Nobel Prizes share is only 2.2%. So that I think is enough to share that where is the innovation. Another parameter, let me say the patents. Our Vice Chancellor was also sharing here today's conference outcomes and papers, also mention the patents. Friends, total that is 3 million patents so far has been filed, granted, out of which only 0.3 million are only to the credit of our country. About 10 million alone to China. So I'm simply just sharing here the statistics. If you are talking about how the technological innovations are going on and the way rapid growth in all segments 360 degrees going on, I think that is going to change and redefine the existing scenario in a huge way. I am sharing few of the examples. Like the quantum computing, and more particularly why I'm just mentioning this quantum computing, because here many our people, they are from pharmaceutical industry. Quantum computing is going to benefit largely the two domains. One, pharmaceutical industry, and the second, cyber security. I'm just sharing here. In December 2023, IBM came with a quantum computer, and you know that its total processing capability that is about 1133 qubits. And let me also give a very layman example in terms of the processing comparison. There are primarily three players in your quantum computing. One is IBM, another is Google. Google came with its that is Sycamore, your quantum computer in the year 22. Another is University of Science and Computing Technology, China. They also came with their own your quantum computer. But the latest one and the fastest one is your IBM ones. And there's also another organization, Atom Computing. They also have pronounced that by the year 2025, they will come with a quantum computer of about 1220 plus qubits. Now, let me show you the comparison. Today, the fastest supercomputer across the globe is the Frontier of United States. The second one, Fugaku, that is from China. I'm just sharing the comparison of the capacities. The fastest supercomputer, that is Frontier, if it is solving a problem in 47 years, the same problem your IBM quantum computer can finish only within 4 seconds. This is the comparison of your quantum machines I'm just sharing with you. And I think all our fellow friends, researchers, students, and our faculty colleagues, they are well aware that the current disruption that is going on all the segments, by means of your artificial intelligence, machine learning, deep learning, your blockchain technology, your cloud computing, your IoT, your digital twins, that has given a good boost to the realization of Industry 4.0. Let me quote a very simple example. Using 3D printing, which we also call additive manufacturing. In Chennai, only in a record time of 3 weeks, and that too at the cost of that is your cost of 60%, curtailing the cost. It manufactured a 2 BHK duplex house in only 21 days. This is the power that people are perceiving, and in our day-to-day processes, our organization already has started adapting to that. And another example I'm also giving, because being the people from our healthcare, another dimension from 3D to what? Shifting to 4D as well. You know, the kidney, liver plants. There's one company that is owned by Elon Musk, Neuralink. Neuralink, in collaboration with Tesla and Google, they already had started even implanting your brain chips. And by means of your brain chips, the entire imprint, my thought process that is going on, that could be brought on the machine. And if you want to modify it, it could also be modified and it could be again uploaded there. And this led to what? A big controversy. I'm just letting you know. OpenAI. Sam Altman is the CEO of OpenAI. And Microsoft is pumping huge investment in OpenAI. You know, even Sam Altman, it was thrown out of OpenAI, who was the founder, director out of total, a board of directors of 7 people. But lately again he joined. You know what was the reason why he was thrown? It was told that our OpenAI has developed a technology that may surpass the human capabilities, that is leading to what? That is artificial general intelligence, AGI, that will learn of its own and it will strengthen of its own in all the capabilities across. That was the main reason. And this is what exactly I think many of you could be aware, but let me also share with you. The way AI is moving forward, Cosmos and God AI, these are the new terminology which have moved across within the technological innovations today. So when I'm saying all this is only just to help our young researchers and our students. Innovations would stem only after we start thinking and then leading to what? Our creative task. I'm also here just sharing one or two examples. Many of you could have also heard the name. Only a 17-year child, Gopalji, from Bihar, who is also known as a banana boy. He, from the banana leaf, he created gold. And at the age of 20, he became managing director at one of the enterprises. Again, another name I'm also quoting, Parno Mistry. Parno Mistry had been a student from one of the colleges at Anand in Gujarat. Having graduated from that college, he is moved to MIT. But during his college days at Anand in India, he came with a very novel idea. And the novel idea was what? On our mobile, we are just zooming in and out feature. This is his brainchild. And this is called the sixth sense technology. It means what we are just gesturing, gesture-based technology he developed. And today, you know, one of the very premier organizations, that is your Samsung, he rose at the age of 37 years as senior vice president of Samsung Research Group. This is what the power of the innovation. I'm also just giving another name, Arnav Kapoor. Arnav Kapoor, he came with a device, and that is called alter ego. And this alter ego you can hang on your ear, it can stick to your face, and whatever what we are inculcating inside, we are not speaking, because when we say speak or we make some gesture, we have the different technology, it can sense and recognize and capture our actions without making any movement. Whatever is inner level, it's going on from your brain, what kind of your that is your inner actions, it can read those actions and it can perform that task. It means, for example, if I'm just here looking at the TV and here I want to change the channel, and whatever my brain wants to take an action, it is automatically doing it. It is syncing with that operation that it is performing an action. This was the creation of Arnav Kapoor. So in this way, there are not many things. Friends, at the same time, I could also help you remind, when we are moving in this moving forward direction that is rapidly growing, at the same time, it is also bringing several risks and threats. If you talk about 3.1 trillion US dollars, that is the total revenue for our cyber crime. And on the cyber crime ladder across the country, we are at number 11. With what percentage? 3.1% of the total crimes. So that's why we also have to be very, very careful. And when we say that is what kind of crimes, I think all you could be witnessing I mean, in every that's your social media platform or in the print media or electronic media, the kind of threats our AI is bringing for us in different forms, whether it is your deep fake, you could be just communicating a person is just a chick check is with me. It's not the same person who should be the original one. It's not the one. I'm just giving some example. Google came with it's one of the important models that is called Gemini. And what is doing? That is from text with your simple dictations, it can do anything for you. And when you are talking about like, I just want to create a campus of my own, and that is what a hypothetical idea with me. What it could be creating for you. And that may appear to be as is what I'm just dreaming. Similarly, in the world of cybercrime, ये कहते हैं तू डाल डाल तो मैं पाक पाक. And that's also very important that we also have to be very careful. I'm just giving like ChatGPT. There's also another one that is called along with it Chat Worm, WORM. It may be also could be writing a spoofing email. It could be writing a phishing email for you. It can be, you can say, just helping you to what? Go in the world of crime. Similarly is about the deep web. So there are, lot many things that we have to be very vigilant and we have to keep an eye on. But at least we certainly should not stop innovating further. With all these words, I would like to thank you very much. And I'll also just more particularly because I will just like certainly supplement one thing. That is, we should move forward. At the same time, we also should keep an eye onto the kind of possible crimes. And that's why we have to be more secure. We have to exercise utmost care. And that's why I'm just sharing two lines. मांझी तेरी कश्ती के तलबदार बहुत हैं, कुछ इस पार और कुछ उस पार बहुत हैं. जिस शहर में खरीदी है तूने शीशे की दुकान, उस शहर में पत्थर के खरीदार बहुत हैं. We have to be very good. Thank you very much.
Thank you, sir. Thank you for your wonderful words. Now, I would like to request our special guest. I will welcome him, Mr. Sanjay Gakhar. He is Vice President and Regional Head of Business Development at MCX Delhi. He has experience of more than 2 decades in commodity markets. His area of expertise includes commodity derivatives, supply chain management, foreign trade, and relationship management. Prior to joining MCX, he has worked with NAFED Limited, a national level corporate marketing organization for years. While at NAFED, he was involved in large-scale procurement and foreign trade operations. He has also worked with Britannia Industries Limited for a year in their bread manufacturing unit. He is BTech Agriculture Engineering and PGDRM from IRMA Anand 1992-94 batch. Please have a huge round of applause for Sanjay Gakhar ji.
So good afternoon to everyone. It is my immense pleasure that I'm here. I carry a very proud legacy of my 2 children who have studied at MVN Sector 17 Faridabad, and they are kind of successfully settled now. The kind of rigor MVN ecosystem follows when selecting the students and the faculty probably is one of the best in India, and that is why you have products like the twice time toppers of IITs and all that all India exam which the government of India conducts. So it is my honor to be here. I have known Professor Dr. N.P. Singh for the last almost 25 years. I have been a student, have been blessed, when we were studying during our MBA, when we were studying marketing, he was the first professor who brought out a course called IT-based models to be used for marketing. I think that time even the computers were not that up to the mark, so to speak. But he is very forward-looking, and the kind of so some of the words which were kind of coined here. The theme of the conference is academia to corporate. One word which caught my attention is multidisciplinary. The people who are sitting on the dais, they belong to such a diverse set of fields. So it is not by default, it is by design that they have been invited here. I'm in great company here. Uh, Good to listen to all of them. The industry which I represent is called financial markets. I don't know whether you are aware about it or not. If you are not, I would request everyone, including the students and the faculty, to kind of brush up on this side of the world, because roti kapda makan to sabke paas hota hai. उसके बाद wealth की जो चिंता करनी होती है, वो wealth comes from the financial services industry or the financial markets. So I will just throw some numbers. These in terms of size of the market, in terms of size of the economy, we are at $3.5 trillion. Indian economy, one of the fastest growing economy in the world, across segments of manufacturing, services, IT, even agriculture. Graduates coming with innovative ideas in agriculture. So it has become kind of technology enabled agriculture. It has become, so we are growing at one of the fastest rates. Probably we'll keep growing. The kind of vision our Prime Minister, Honorable Prime Minister, has had, by 2047 we'll become like, we are now $3.5 trillion economy, but we'll become like around 35-40 trillion size of economy. So as students, you are sitting in the golden period of India, because this is the real growth you are seeing. There are various segments of the financial market. So there is one equity segment, then there is a commodity segment, then there is a currency segment. All these segments are regulated as per the best global practices by sectoral regulator SEBI. This market has grown in large numbers over the last 5 years. So again, some numbers. We had around 3 crore clients, people who open their retail accounts with various brokers. We had around 3 crore clients by 2019. Now that number is 15 crores. So 5 times growth in the size of the or the base of the client numbers. We are a population of 140 crore. Just imagine if the average income of people touches a certain level, what is the kind of explosive growth this industry is going to get. So all these segments serve a different purpose. Equity market is kind of for your working capital requirements and for creating wealth for people who do long-term investments. The assets under management, for example, in the mutual fund industry, have grown 10 times in the last 5 years. The size of transactions which are taking place in the currency and equity and commodity markets are of the size of hundreds of lakhs of crores every day. It is not in 1 year, but it is every day. This is typical multidisciplinary segment of the industry, where you have people who use technology skills, people who use economics, people who understand commerce and manufacturing come. So it becomes some kind of a sangam of knowledge from all the disciplines of the academia. So I'm very proud to be here, and good luck to the conference. So we have some discussion in the afternoon session also. Probably there I'll talk about more about my industry, the commodity derivatives market. But I'll just throw some numbers at you or some concept at you. If you are looking at if you want to know what would be the price of gold after 6 months, price of gold, silver, so many other commodities. So MCX is the platform where future prices, say price after 4 months, after 6 months, is visible right today. So if you want to buy gold after 6 months, but you want to know the price today, that price is available today. How it benefits various people. So there is a farmer, very small farmer, growing menthol oil in UP, he can look at the menthol prices on MCX and then decide whether to sell that crop today or after 3 months. So that is the platform I'm coming from, and we'll discuss in details about how the mechanism works in the later part of the conference. But thank you very much. Thank you.
Thank you so much, sir. Now, I would like to introduce a guest of honor, Dr. Vijay Bhalla, Treasurer IPGA Central and Principal SDT College of Pharmacy, SDT University, Gurugram. He is an experienced director with a demonstrated history of working in the pharma education management industry, skilled in pharmaceutics, pharmaceutical research, good laboratory practice, verification and validation, and pharmacovigilance. Strong healthcare professional with a Doctor of Philosophy focus in clinical pharmacy. I welcome you, sir. I request you to please come on this dais and address our gathering.
Thank you. Good afternoon, everyone. Dignitaries of the dais. First of all, I must thank the management as well as the Vice Chancellor, MVNU University, for giving me this opportunity to interact with a large population here, which comprises of all type of including students, faculty members, industry personals, and all that. So in fact, I would start with the topic only, our campus to corporate. So in campus, if we look at, in campus, we are given a lot of exposure to the knowledge. The very first step to anything, I think, is a knowledge. And knowledge is a one very important integral part if we see. But I'm sad to inform many of the students, they restrict knowledge to the remembering only. They just mug up the things. They not go to the another step of the knowledge, which is more important, that is an understanding. If they understand well this concept, they are ready to apply and analyze also the learnings which they had. And of course, later stage, there are a very less population, less than 1%, I would say, who are really committed, and they are in the stage of evaluating and creating or designing a new thing that is called innovation. So if we look at that, in campus, we get knowledge, we get competencies and skill set. The percentage of competencies and skill set comes with if we apply knowledge. Though our curriculums has been well designed, a new education policy is at place. So of course, we are working on the development of the skill set, but our competencies, of course, yes, is not enough to what industry is looking forward. And then, of course, comes a very important third and fourth pillar, which are your behavior and your attitude. So I would just inform that students, 70 to 80% go for knowledge, 10 to 12, 30% go for the competencies, skill sets, and very less percentage they really invest on the attitude and behavior, though attitudes sometimes are inherited and they carry forward. But if we go to industry, they go reverse in 180 degree. Industry would first look into your attitude. What exactly are you really positive to take up the positions which they are really offering to you? Then they will definitely look at your behavior. Are you a good team player? You are going to really match to the company's culture and all that. And of course, then it comes the skill sets and competencies. Most of the companies work in a very different domains. They don't work in one single domain. If someone is in manufacturing, they are in manufacturing. Someone in sales, someone in, of course, regulations. So those competencies, they are there to help you out to develop, provided your attitude and behavior is very good. And of course, finally, knowledge also can be imparted. And knowledge is nothing but an updation. Every day, I'm thankful my previous speakers has really involved and given us a very updated information and knowledge on the various aspects of campus to corporate. So if we look at the industry, it has grown from 18th century. If we look from simple handicraft to a machine manufacturing, then from machine manufacturing to adaptation of electricity, and then making a mass production, and then from mass production to an automated memory systems. And of course, Dr. Pandey has told that now the industries has adopted a very sophisticated computers and robotics also with communication, so that we are very fast. And I think that the artificial intelligence is on the way, and we will still progress more. So all this are very important if we really want to progress, and if we simply understand this healthcare industry. It is not purely a medicine these days. Physicians, it comprises of all other allied health sciences also, computer engineering also, law and regulations also. So this university offers all those programs and courses which really complementary to the healthcare system in one or other way. So that is very important. And if we look at the growth, growth is nothing but a possession of the things. I am possessing an Apple phone, MacBook, and these things. But if we look at the progress, in progress with growth, we need to add some ethics in it. Our ethics, if they are there, we will be, people will be looking at us that he has really grown in his field. And of course, if we look at the success, success again, it is not a growth or progress. It is progress with humanity as well as morality and spirituality. And if you want to be a successful, I have one very lightning example, Pramod Dattaji. I have seen him really succeeding in his entrepreneurship and in his life, because he is a man with all that progress plus humanity as well as that moral values in that organization. What one problem with these days as students is they look for a job, they do not hunt for the career. Job is in working for someone in exchange of money, but career is built gradually. You look for a platform which will give you your interest areas, your competencies are sharpened there, and gradually you grow there, and then you build a career in that particular segment. So all that is very important for student. Don't look for a job, hunt for a career. Don't hunt for a job or look for a career or build a career. That is very important aspects in this life. So in the last, we all of us has to eat something, and our brain deserves the best eating. So I will give an acronym of EAT. EAT is EAT. E here is an ethics. Carry ethics wherever you go. A is an attitude. Have a positive attitude. And the T is a building team. Build a good team so that you are a successful person. Valuables which you are carrying can only impress others, but value if you carry will inspire others. With these words, once again, I compliment everyone. Thank you very much and good luck.
Thank you, sir. Now, I would like to introduce our chief guest of the day, Shri P.K. Datta ji. He's a luminary whose journey through academia, corporate, and philanthropy stands as an testament to his dedication and invincible spirit. He embarked on his academic journey with a profound commitment to learning, and he has done his BSc honors in zoology from the esteemed Government College, Chandigarh. In 1986, Shri P.K. Dattaji embarked on an entrepreneurial journey. Founding Cystopic Labs Private Limited is a visionary enterprise that has flourished under his stewardship. Shri P.K. Dattaji is a shining example of success and service, effortlessly balancing his professional achievements with a steadfast dedication to social welfare. His remarkable journey serves as a beacon of inspiration for the youth, motivating us to pursue greatness and make a lasting impact through compassion, leadership, and services. I would request you all to please have a huge round of applause to welcome Shri P.K. Dattaji on the dais.
Thank you very much. First of all, the students who are sitting at present, if they are pharmacy students, and there may be students of different faculties, I would like to share with them that even at the age of 78, I am a student. I am learning every day, and I am learning every moment. If you come to my room in my office, my door is always open. I am available to anybody, everybody. And people say, you do nothing. I say, no, I do not do anything. I only think. And I tell you, thinking is going to be a big change in life. If you people develop thinking, I have put a board there that we punish nothing, but we reward creativity. We reward imagination. People were addressing me as doctor. I am not a doctor. You will be all surprised how I got the title of a doctor. I had gone to Singapore with a dermatologist, eminent dermatologist of India. And there was one Dr. Bajaj from Allahabad. He introduced me P.K. Datta, MD. He introduced me P.K. Datta, MD, cystoscopy. So one of the doctors there asked me, okay, from where you have done your MD? So Dr. Bajaj replied, he is not supposed to tell you his college. Yeah. So nobody asked me. And then they had a dermatology conference in Singapore. And after the conference, I learned that they have appointed me as a founder member of their body, which they established in Singapore, called as Contact and Occupational Dermatosis Forum of India. I was made their founder member. I again protested, okay, I'm not a doctor. They said, Mr. Datta, you are more than a doctor to us. You have been instrumental in ensuring that environment and environmental factors can cause pollution and cause allergies. You will be surprised, as a small pharmaceutical company, we gave to our dermatologists the first kit from which they can measure to which thing you are allergic to. That allergy may be due to food you are taking, that allergy may be due to anything which you are exposed to. And that kit is still available to them for almost since 95 till today, almost free of cost. This is our company. And you see, when I started the organization, I started from Haryana. I was in Faridabad. My address was 16/4 Mathura Road, Faridabad. बड़े proudly हम कहते थे, क्योंकि my father belonged to Haryana. He was a government servant in Haryana, and he had enjoyed his innings in Haryana. So I came all the way from Bombay to invest in Faridabad, and that too in a factory to start with. At that time, most of the people used to come in this line to get products manufactured from outside. But what happened with us? We were very lucky. When I thought of my company, I had 2 rupees in my pocket. And next day, I had, in 1986, I'm talking, 2 crore 46 lakh rupees in my bank account. And they had all written, who had sent me the money, payable whenever. I was surprised. I called my directors. I said, okay, we are going to start a factory. They said, how can we start a factory? I said, because once we have such a credibility that when I think of a company, I get so much money from my friends, and most of my friends were for people from Gujarat. People from Gujarat. And I had named the company earlier as Savior Pharmaceuticals in the name of God, because I believed in God. I still believe in God. I still believe in ethics. I still believe in belonging and emotional attitude. Why not? Even computer may come. Computer cannot replace emotions. Computer may do any advance. Science may do any advance, but you cannot replace emotions. You cannot replace anything. I am of firm view. Then my trademark attorneys informed me, "Okay, Mr. Datta, your savior name is clashing." So on those days, there was no mobile phone, nothing. So we were sitting in a telephone exchange, and I told my friend that I was in Bombay. Okay, within half an hour, I will give you a new name. So I suggested him. My trademark attorneys are Acme people, Anands in Delhi. They are the pioneers in India in trademarks and patents. And I informed them that my company's name is Systemics and Topicals. Medicines are only of two types. One which go in the system, and second which are applied to the system. Topicals. He said, Mr. Datta, can you make it better? I said, yes, give me half an hour more. And we came with the name Systopic. Systopic in pharmaceutical industry is the most scientific name, systemics and topicals. Just think of idiot like me. I always call myself an idiot. I always call myself the most stupid person. I enjoy it. People say, okay, why you call yourself stupid? Because I have done a lot of innovations. I have done a lot of imagination, and I have done a lot of thinking, which I have implemented in life, and that implementation is successful. This year, I am likely to touch 900 crore rupees turnover, which is equivalent to 4,500 crore rupees turnover companies. My pricing is so economical that I have not to spend any money on doctors for promotion. My representative goes and promotes to the doctor that technologically most advanced company, and at the same time with patient-friendly pricing. I will give you one example. We thought of launching Rabeprazole, and Rabeprazole is a PPI, because many of you may be pharmacy students, may be knowing it. And when we thought of it, my people who were from marketing department, most of them M-Farm and B-Farm, they recommended me, Mr. Datta, you will have to keep a name with R, because Rabeprazole was mostly available with the name starting from R. I said, no, that will be foolish, because I am the 40th player entering that market. 40वां आदमी हूं जो उस मार्केट में एंटर कर रहा हूं, पर मैं अगर इसका नाम आर से स्टार्ट करूंगा तो डॉक्टर को मेरा नाम याद नहीं रहेगा. तो उन्होंने कहा, दत्ता साहब आप क्या नाम रखोगे? तो मैंने कहा, आधा घंटा दो, सोच के बताता हूं. तो मैंने उनको नाम दिया सायरा, CYRA. आज जो मेरा ब्रांड है, इस साल 250 करोड़ रुपए की सेल करेगा, सिंगल ब्रांड. और जो मेरे बाकी इंडस्ट्री के फ्रेंड हैं, उनको मैं बताता हूं, मैं सिर्फ 2 रुपए की गोली बेचता हूं, और मेरे इंडस्ट्री फ्रेंड उसी टैबलेट को 12 रुपए 14 रुपए की बेचते. तो आप यहां से फर्क लगाइए कि जहां आपका पैशन हो, आप कुछ भी कर सकते हैं. आप ये मत सोचिए कि हम लोग, मेरे को समझ नहीं आता, हर एक आदमी जॉब क्यों ढूंढता है? हर एक आदमी में कैपेबिलिटीज हैं, हर एक पर्सन में पोटेंशियल है, हर एक पर्सन में परफॉर्मेंस का पूरा सब कुछ भरा हुआ है। मैं अपने टाइम का पॉसिबली मे बी वर्स्ट स्टूडेंट कहूंगा अपने आप को, क्योंकि मैं, बच्चों आप हैरान हो जाएंगे, मैं एमएससी एंटोमोलॉजी हूँ, और उस वक्त एंटोमोलॉजिस्ट के बाद मेरे को गवर्नमेंट कॉलेज चंडीगढ़ में लेक्चरर की जॉब मिली, जिसको कहते थे डेमोन्स्ट्रेटर। उस वक्त पीएचडी की रिक्वायरमेंट नहीं थी। यहाँ तो बहुत से स्कॉलर्स बैठे हैं, सारे पीएचडी बैठे हैं, तो मेरे को एज ए डेमोन्स्ट्रेटर जॉब मिल गई। और मैं कुछ महीने पढ़ाने के बाद वो नौकरी छोड़ आया, तो मेरे पिताजी मेरे से कहने लगे कि यार तूने नौकरी छोड़ दी। तो मैं बात कर रहा हूँ बच्चों 1970 की। तो मैंने डैडी को कहा, डैडी मेरे को वहां पे बड़ा कॉम्प्लेक्स हो रहा था कि आई वॉज ए स्टूडेंट यूनियन लीडर हैं कॉलेज के अंदर, और कॉलेज में ही प्रोफेसर चाहते थे कि मैं उनके साथ चलूं, स्टूडेंट चाहते थे मैं उनके साथ चलूं, तो आई वॉज नॉट एबल टू डू जस्टिस टू माई जॉब। दैट इज वाई आई लेफ्ट माई जॉब। दिस वॉज माई conclusion to my father, and my father asked me what you will do. I said I will join pharmaceutical industry. तो कहते कैसे ज्वाइन करोगे? मैंने कहा फिक्र ना करो, नौकरी चल के आएगी, नौकरी मेरे पास चल के आएगी। पिताजी हमारे हैरान हो गए कि भाई हाउ a job will come running to you. I was lucky. मेरे एक दोस्त थे, उनका चंडीगढ़ सेक्टर 17 में एक बियर बार था, तो मैं उनके वहां बार में गया, तो मैंने अग्रवाल जी से, सुभाष अग्रवाल मेरे क्लास फेलो थे वो, मैंने उनको बोला कि कहते क्या करना चाहता है? मैंने कहा कुछ नहीं, मैं तेरे से रोज 50 रुपए कमाऊंगा। वो बड़ा हैरान हुआ। तो मैंने क्या किया, जो वहां बियर पीते थे बार में, मैं बोतल बाहर नहीं जाने देता था, बोतल बार में रख लेते थे, 8 आने बोतल बिकती थी, तो हम 150-200 बोतल रोज बेचते थे, 50 रुपए शाम को मेरी जेब में होते थे। तो इस तरीके से मेरी जॉब स्टार्ट हुई। उसी बार के अंदर किसी फार्मास्यूटिकल कंपनी के लोग बैठे हुए थे, उन्होंने मेरे को देखा है कि ये बंदा तो बहुत डिफरेंट लग रहा है, बात भी अच्छी करता है। उन्होंने मेरे से पूछा जॉब करोगे? मैंने हाँ करूंगा। तो मैंने कहा आपकी कहाँ कंपनी है? कहने लगे जी हम तो ऑर्गेनॉन इंडिया से हैं और हम यहाँ पे इंटरव्यूज करने आए हुए हैं। तो मैंने कहा यू कैन इंटरव्यू मी टुमारो। तो अगले दिन मैं गया, नौकरी मिल गई। तो डैडी कहते यार ये तो बड़ा जबरदस्त काम है तेरा, तूने एक नौकरी छोड़ी दूसरी नौकरी मिल गई। तो बेटे मैंने कभी नौकरी इसलिए नहीं ज्वाइन की कि मैं नौकरी ज्वाइन करना चाहता, मैंने इसलिए नौकरी ज्वाइन की कि मैं नौकरी से सीखना चाहता था, लर्निंग चाहता। और उसने मेरे को टोटली बदल दिया। आप हम इमेजिन करो बच्चों, उस टाइम की बात कर रहा हूं, आज सर कंप्यूटर की बात करते हैं, हमने तो कभी कंप्यूटर को चलाया नहीं आज तक। अब तो आ गया, तो आफ्टर कोरोना की सबसे बड़ी देन ये है कि उसने सब कुछ डिजिटल कर दिया और सब कुछ कंप्यूटराइज हो गया, और आजकल तो बच्चे भी कंप्यूटर पे सीखते हैं और टीचर्स भी कंप्यूटर पे सिखाते हैं। आप इमेजिन करिए, एक टाइम था, अब मैं अपने घर से अपनी सारी फील्ड फोर्स को कंप्यूटर पे एड्रेस कर लेता हूँ। मुझे टूरिंग की जरूरत नहीं है, जर्नी की जरूरत नहीं है। हमने एक बोर्ड लगाया हुआ है, उस बोर्ड से आई कैन एड्रेस 1200 पीपल। देयर इज नो नीड ऑफ गोइंग टू एनीबॉडी। तो एक्सेस जो है वो बढ़ गई। तो दोस्तों ऐसा है कि जिस इंडस्ट्री का मैं पार्ट हूँ, फार्मास्यूटिकल इंडस्ट्री का, आज डॉक्टर पांडे ने बहुत अच्छी बात कही। उन्होंने बात कही कि भाई हम मेडिसिन की डिलीवरी सिस्टम को कैसे बदलें। ये सबसे बड़ा रिसर्च का टॉपिक है दुनिया भर में। अब दुनिया भर में क्या टॉपिक चल रहा है कि अगर कोई चीज नोज के थ्रू ब्रेन में जल्दी पहुंचती है, तो अब वो नेजल ड्रॉप्स पे आ गए हैं। नेजल ड्रॉप से ही सीधा प्रोडक्ट ब्रेन पे पहुंच जाएगा। इट विल नॉट गो टू लिवर, इट मे नॉट गो इनटू द सिस्टम। तो ऐसे ऐसे बदलाव आ रहे हैं और मैं उन बदलावों का हिस्सा हूं, पार्ट हूं। मैं चाहता हूं हर एक चेंज को पहले अडॉप्ट करूं इंडस्ट्री में, जो इंडस्ट्री बाद में लाएगी मैं पहले लेके आऊं। मैं आपको छोटी छोटी 3-4 एग्जांपल दूंगा, आपका ज्यादा टाइम नहीं लूंगा। आइडिया ये है कि जब मैं आपके पास आया हूं तो एटलीस्ट आपको एक मैसेज तो कन्वे करके जाऊं कि सिर्फ नौकरी और सिर्फ वो, मैं हैरान होता हूं कि बच्चे बी फॉर्म एम फॉर्म करने के बाद अपने सिग्नेचर किसी को दे देते हैं और वो कैमी शॉप खोल लेता है। इट इज ट्रेजरी। बच्चों को अपनी नौकरी में अपने आप को आगे बढ़ाने के तरीके सोचने चाहिए, अपनी प्रोग्रेस के तरीके सोचने चाहिए, इंडिपेंडेंट होने के तरीके सीखने चाहिए। जब हमारे जैसे लोग जिंदगी में कुछ कर सकते हैं और कुछ कहीं पहुंच सकते हैं, तो आप तो हमारे से आगे जाएंगे। आप हमारे से ज्यादा क्वालिफाइड हो, आप हमारे से ज्यादा पढ़े हो, आप एम फार्म करोगे, आप पीएचडी करोगे, तो आपके पास तो प्रोग्रेस के चांसेस और ज्यादा है। तो दोस्तों, मैं सिर्फ आप लोगों से यही कहूंगा कि जॉब भी सीख करो तो जॉब भी ऐसी जगह सीख करो कि जहां पे थोड़ी देर रहो। मोस्टली लोग नौकरी ज्वाइन करते हैं फॉर गेनिंग एक्सपीरियंस, वो दूसरी जगह अप्लाई करते हैं। मैं कहता हूं ये बहुत ज्यादा स्टूपिड प्रोसेस है कि आप कहीं भी नौकरी ज्वाइन करो, एटलीस्ट स्टे तो करो। मेरी कंपनी में तो कोई, आप मेरे ऑफिस में आएंगे, आपको एक पीएन में मिलेगा 25 साल, ड्राइवर मिलेगा 25 साल, और 120 एम्प्लॉइज हैं कंपनी के अंदर, मेरे ख्याल सबकी 25 साल की सर्विस है। हमने किसी को निकाला नहीं। जब से अपना ऑफिस बनाया दिल्ली में, हमने किसी को निकाला ही नहीं। और आप इमेजिन करो, मेरे को लोग कहते हैं कि दत्ता साहब वो आदमी तो आपकी कंपनी को डुबो देगा। अरे यार, मैंने कहा क्या हुआ? कहते जी वो तो बहुत एटीट्यूड उसका ठीक नहीं है, डेरोगेटरी है, ये है वो है। तो मैं कहता हूँ कोई बात नहीं यार, वी विल मेक हिम रिटायर, वी विल नॉट टच हिम। तो कहते क्यों? मैंने कहा रॉन्ग सिलेक्शन। गलती किसकी है? हमारी। तो जहां प्रोग्रेस होनी है वहां पे अपनी गलतियों को एडमिट करना बहुत जरूरी है। हमारी सबसे बड़ी प्रॉब्लम यही है बच्चों कि हम कभी भी अपनी गलती मानने को तैयार नहीं। और मैं तो ये बात सोच के चलता हूं कि दिन में काफी चीजें सोचता हूं और शाम को डिसाइड करता हूं कि आज कुछ वर्थवाइल ग्रोथ आई कि नहीं आई। क्योंकि मैं हमेशा मानता हूं कि आपका सबसे बड़ा दुश्मन आपका दिमाग है। ये दिमाग आपको आगे बढ़ने नहीं देता, तरक्की करने नहीं देता, ग्रोथ होने नहीं देता। ये आपको कहता है कि मैं आई मस्ट लीड ए कंफर्टेबल लाइफ, आई मस्ट हैव कंफर्ट ऑल अराउंड। मैं देख रहा था काफी बच्चे यहाँ से उठ के चले गए थे, अच्छा हुआ मेरे लेक्चर के टाइम एटलीस्ट आ गए हैं, दे विल गेन समथिंग है, तो ये बड़ी अच्छी बात है। क्योंकि मैं सोच रहा था कि पर्पस सब नहीं होगा अगर मैसेज कन्वे ना हो। और मैसेज कन्वे करने का बच्चों एक ही तरीका है कि इनोवेशन, इमेजिनेशन और क्रिएटिविटी, ये 3 चीजें हैं जो आपके पास सबसे बड़ा धन है। आप इन चीजों को कल्टीवेट करिए, बनाइए। अब यू विल बी सरप्राइज्ड, माय कंपनी हैज लॉन्च्ड 5 प्रोडक्ट्स फर्स्ट टाइम इन द वर्ल्ड मार्केट। 5 प्रोडक्ट्स, और मैंने उनके ऊपर बायो इक्विवेलेंस भी किया, क्लिनिकल ट्रायल भी किए, सब कुछ किया। और आज तक आई डू नॉट बिलीव इन एनी शॉर्टकट कि लोग कोई प्रोडक्ट ले आते हैं, किसी से बनवा लेते हैं। आई स्ट्रांगली बिलीव कि अगर जो काम करना है उसको निष्ठा से करो, उसको कमिटमेंट से करो। तो दोस्तों, ये चीजें लाइफ के अंदर मोस्ट इंपॉर्टेंट हैं। बाकी देखो, हमारी तो बच्चे उम्र बीत गई, पर हम चाहते हैं कि एटलीस्ट अगर मेरा मैसेज आप में से बैठे हुए 10 लोगों को भी पहुंच जाए, तो दे विल स्टार्ट क्रिएटिविटी, दे विल स्टार्ट इमेजिनेशन एंड दे विल स्टार्ट डूइंग थिंग्स, तो थिंग्स विल हैपन। और मेरा तो लाइफ का असूल है, डू द डूएबल, मूव द मूवेबल। जो आप कर सकते हो करो, और जो नहीं कर सकते उसको छोड़ दो। क्योंकि जो चीज आप अकम्प्लिश कर सकते हो, दैट इज व्हाट यू आर कैपेबल ऑफ। कभी ये मत सोचो कि वो कौन सी गाड़ी में घूम रहा है, वो किस घर में रह रहा है। ये देखिए कि you will say कि one day I can create all these things. तो ये चीजें जो हैं बच्चों जिंदगी में आपको बहुत तरक्की देंगी, आपके टीचर्स को बहुत तरक्की देंगी. अब टीचर, मैं हैरान होता हूँ कि मेरे को तो आपके स्कूल का नाम जो है बहुत बढ़िया है, जिसने भी नाम रखा मॉडर्न विद्यालय, विद्या निकेतन, कितना बढ़िया नाम है. और मॉडर्न विद्या निकेतन, मैं फरीदाबाद में ही रहता था, 16 माइल 4 मथुरा रोड, और मेरे को याद है कि वो बड़ा पुराना स्कूल है वहाँ पे और बहुत सक्सेसफुल स्कूल है. और वहीं से आपकी यूनिवर्सिटी बनी, MVNU यूनिवर्सिटी. ये बहुत बड़ी उपलब्धि है कि आप सब एटलीस्ट यूनिवर्सिटी लेवल तक पहुंचे. और आपके जो प्रोफेसर साहब हैं, गर्ग साहब, इनको तो मेरा ख्याल है कि कम से कम 25-30 साल हो गए हमारे को आपस में मिलते और जानते. और लखा जी भी आ गए आपके साथ. तो मेरा आप सब लोगों को एक ही मैसेज है कि जिंदगी में आपने आए हैं तो कुछ करके जाइए, कुछ दे के जाइए. और आई स्ट्रांगली बिलीव कि हमें लेने का, मांगने का हक नहीं है, हमें खुद मिलना चाहिए और खुद मिलता है. मेरे को जो कुछ जिंदगी में मिला है ऊपर वाले ने दिया. मैं नहीं कहता हूं मैंने क्रिएट किया है, मैं कहता हूं उसने दिया. क्यों? क्योंकि उसने हमें अच्छी सोच दी, अच्छे विचार दिए, हमें ग्रेटिट्यूड दिया. हमें ये सारी चीजों को कल्टीवेट करके आगे की सोचनी है. और जहां तक जब आप आगे की सोचोगे तो बहुत तरक्की होगी वर्ल्ड के अंदर. हम रहे ना रहे बच्चों, आपने तो सरवाइव करना है, आपने आगे बढ़ना है. तो अपने लिए ख्याल करिए. गॉड ब्लेस ऑल ऑफ यू. आई एम फुल ऑफ ग्रेटिट्यूड टू ऑल ऑफ यू.
Thank you, sir. Thank you very much. Your words motivated all of us.
एक बारी सभी बच्चे सारे खड़े होके एक बार जोर से ताली बजाएंगे. इतनी अच्छी बात इन्होंने कही है. और मैंने इनको अभी थोड़ी देर पहले कहा था कि थोड़ी सी अपनी स्टोरी के बारे में बताना ताकि बच्चों को ज्ञान मिल सके.
Once again, thank you, sir. Thank you very much. Now, I would like to introduce to you our guest of honor, Mr. Dhanesh Adlakha ji, President, Haryana State Pharmacy Council. I request our Honorable Vice Chancellor, sir, Professor Dr. Arun Garg, to please welcome him. Everyone have a huge round of applause for Mr. Dhanesh Adlakha ji. Huge round of applause, everyone. Now, I request our Honorable Dr. S.C. Manchanda ji to please come on the stage area. And I request our Controller of Examination, Dr. Kuldeep Tamar, to please welcome him today here. guys have a huge round of applause for Dr. S.C. Manchanda ji. He is the former Secretary of Railway Board, India. Thank you, sir. It is now my pleasure to introduce to you Shri Dhanesh Adlakha ji. He is President of Haryana State Pharmacy Council and ex-President of PCI. Mr. Dhanesh Adlakha is a distinguished leader in pharmaceutical sector, currently serving as the President of Haryana State Pharmacy Council with a background of pharmacy from JSS University under the guidance of Professor B. Suresh. He brings a vast experience in advancing pharmacy practice and regulatory standards. Shri Dhanesh Adlakha's leadership embodies a commitment to advancing pharmacy practice, promoting public health, and ensuring medication safety in Haryana. Through his visionary leadership, he continues to shape the future of pharmacy for the betterment of the profession and communities it serves. Please, everyone, have a huge round of applause for Shri Dhanesh Adlakha, and I request Mr. Dhanesh Adlakha to please address the gathering.
कहते हैं गुरु ब्रह्मा गुरु विष्णु गुरुवे साक्षात परब्रह्म। मैं आदर एवं सम्मान के योग मेरे जैसे बहुत छात्र जो आज फार्मेसी प्रोफेशन के अंदर पूरे देश के अंदर पूरे विश्व के अंदर कहीं ना कहीं सेवा दे रहे हैं, ऐसे गुरु डॉक्टर अरुण गर्ग जी, दत्ता जी और मेरे मेंटर नरेंद्र आहूजा जी, जय बालन जी और सभी मेरे साथी। अभी जब दत्ता जी कुछ बता रहे थे तो हर व्यक्ति की जिंदगी में कोई ना कोई एक स्टोरी जब वो स्टार्ट करता है तो जरूर होती है, क्योंकि जब इंसान चलता है ना, आप कभी भी कोई छोटा बेबी होता है हर एक के घर में होता है, वो जब चलता है पहली बार जब चलता है तो खुशी भी बड़ी होती है और वो माँ अपने हस्बैंड को, अपने फादर इन लॉ को, मदर को, ग्रैंड मदर को, नानी को, नाना को, सबको बताती है कि आपने देखा, मैंने उसकी ना वीडियो भेजी है, वो आज पहली बार चला उस बेबी के लिए। लेकिन जब वो चलता है तो कितनी बार गिरता है वो कोई मीनिंग नहीं है, लेकिन जो खुशी होती है कि आज वो चला, वो उसके पेरेंट्स से पूछ के देखो। ये सबके साथ होता है, ऐसा है ना? तो ये चीज कभी भी हर इंसान के साथ है। मैं सिर्फ फार्मेसी बैकग्राउंड पे सिर्फ 4 मिनट से 5 मिनट में आपसे विदा लूंगा। मुझे 2007 में आज के स्टेट ड्रग कंट्रोलर मनमोहन तनेजा जी ने फोन करके कहा कि दिनेश, हरियाणा स्टेट फार्मेसी काउंसिल का चुनाव है, वो आपको लड़ना है। तो मैंने कहा जी मैं तो मेडिकल स्टोर पे काम करता हूँ, मेडिकल स्टोर पे मेरे पार्टनर मेरे को छोड़ेंगे नहीं, मैं कहाँ लड़ पाऊंगा। बोले नहीं, वो बाकी सब कुछ करेंगे, फरीदाबाद आपने देखा। 2007 में नॉमिनेशन हो गया, चुनाव जीत गए। 6 लोग इलेक्टेड मेंबर होते हैं, 5 नॉमिनेटेड, 6 इलेक्टेड। उनमें से फिर प्रेसिडेंट, वाइस प्रेसिडेंट और 1 मेंबर फार्मेसी काउंसिल ऑफ इंडिया के लिए ये चुनाव होता है। मुझे उस टीम में वाइस प्रेसिडेंट बनने का मौका मिला और उस समय के प्रेसिडेंट थे डॉक्टर सुरेंद्र शर्मा। तो उनको हिंदी बोलने नहीं आती थी, वो पंजाबी बोलते थे। वो जो बात कहते थे ना, काका तू इवें कर ले, मतलब उनकी जो टोन थी वो हमने बड़ी कोशिश करी कि भाई आप जब वहां स्पीच दोगे तो कोशिश करना चाहिए आज पंजाबी ना बोलना, हम भाई बाहर जा रहे हैं तो हिसार साइड में थोड़ा सा, पर वो नहीं, उनको वो कहते हैं मेरी जो मदर टंग है मैं वही बोलता। उस जैसा इंसान जिसने इस फार्मेसी काउंसिल के अंदर एक रिफॉर्म लाने का काम किया। फिर दोबारा जब चुनाव हुआ, फिर जीते। सरकार या फरीदाबाद के अंदर मैंने नगर निगम का पहला चुनाव लड़ा, दूसरा लड़ा, तीसरा लड़ा। तीनों बार जब जीते तो मुझे मुख्यमंत्री जी ने मेयर डिक्लेयर किया फरीदाबाद। तो लकली वो पर्ची जो थी वो शेड्यूल कास्ट की निकल आई मेयर की। तो मुख्यमंत्री जी ने कहा कि आपको सीनियर डिप्टी मेयर बनना होगा। मैंने कहा सर मैं बहुत मुश्किल में जीऊंगा कि मेरे जो जूनियर हों उनको मैं सर कह के बोलूं, बड़ा डिफिकल्ट हो जाएगा मेरे लिए, मैं ऐसे ही ठीक हूं। तो बोले आपको कहीं और एडजस्ट कर देते हैं। तो मुझे हरियाणा स्टेट कोऑपरेटिव बैंक्स राज्य मंत्री के साथ चेयरमैन बनाया। मैं बता रहा हूं कि सोच आदमी की खुद नहीं बनती, उसको उसकी मेहनत के साथ बनाती है। जैसे भी दत्ता साहब ने कहा ना कि आप सोचोगे ही नहीं तो करोगे ही नहीं, और करोगे नहीं तो बढ़ोगे नहीं, और करोगे तो ऐसा नहीं है कि सक्सेस हो जाओगे, बच्चे के पैर की तरह लड़खड़ाओगे भी। लेकिन क्या वो बच्चा जो लड़खड़ाता है वो छोड़ देता है उठना? नहीं छोड़ता, उसको और मजा आता है। आप उसको देख के खुश हो रहे होते हो, वो फिर खड़ा होता है, फिर चलता है। तो उसी तरीके से जीवन भी है, उसी तरीके से खड़ा भी होना चाहिए और भगना भी चाहिए। लोग देखें तो आप उनकी तरफ देखो मत कि वो मुझे देख करके हंस रहा है या खुश हो रहा है या दुखी हो रहा है। आप अपनी तरक्की की तरफ बिल्कुल बढ़ते चले जाए। मुझे डॉक्टर जयबालन बैठे हैं, मैं आज तारीफ करूंगा डॉक्टर जयबालन जी की कि मैं इस मामले में बड़ा सख्त हूं कि 2019 से आज तक जिस बच्चे को यदि फार्मेसी प्रोफेशन के बारे में नहीं पता तो मेरे चीफ मिनिस्टर भी मुझे फोन कर लें तो मैं उसके रजिस्ट्रेशन नहीं करता, किसी कीमत पे नहीं करता। होता क्या है कि डॉक्टर दत्ता पिछले 5 साल से इस प्रोफेशन के अंदर केवल एक चीज आ गई कि मुझे डिप्लोमा दिलवा दो। तो वहां क्या होता है कि जो दीवारों पे लिखा होता है ना 10वीं फेल 12वीं करें, पढ़ते होगे आप लोग दीवारों पे 10वीं फेल 12वीं करें, वो उनको ठेका देता है कि मेरी 12वीं भी तू करा दे और मेरी फार्मेसी भी तू करा दे। तो वो हमारे यहाँ ओपन स्कूल्स खुल गए अब सब जगह, हरियाणा स्टेट ओपन स्कूल, नेशनल ओपन स्कूलिंग, उत्तर प्रदेश ओपन स्कूल, वहां वो जाकर के उनकी +2 का जुगाड़ बिठा देते हैं और उसके बाद उसका जुगाड़ बिठाते हैं किसी प्राइवेट यूनिवर्सिटी जहां उसको पेपर देने के लिए जाना ना पड़े, या ऐसी जगह कॉलेज हो कि जहां पेपर का जुगाड़ हो जाए। 5 साल में हरियाणा के अंदर 12,000 सीटें हमारे पास है। मैं आज खुशी के साथ तीसरी बार इस बात को दोहरा रहा हूं, जो बच्चे सेकेंड ईयर में थे उससे में आज वो फाइनल ईयर में आगे होंगे, कि हरियाणा के अंदर हमारे पास पंडित बीडी शर्मा यूनिवर्सिटी कैंपस, एमडी यूनिवर्सिटी, मौलाना यूनिवर्सिटी, गुरु जम्बेश्वर यूनिवर्सिटी, चौधरी बंसीलाल यूनिवर्सिटी, श्रीमती इंदिरा गांधी यूनिवर्सिटी मीरपुर, यहां तो बी फॉर्म एम फॉर्म है ही, लेकिन उसके बाद मैं प्रेज करता हूं जीडी गोयनका यूनिवर्सिटी, KR मंगलम यूनिवर्सिटी, MVN यूनिवर्सिटी। मतलब ये वो लोग हैं जिनका प्रोफेशन से प्यार है, पैसे से प्यार नहीं है, और जिनका पैसे से प्यार है उनकी मेरी दुश्मनी है। वो खूब सिफारिश कराते रहते हैं, खूब रोते रहते हैं, खूब MLA मंत्रियों के पास जाते रहते हैं। मेरे मुख्यमंत्री का मैं धन्यवाद करूंगा कि वो कभी इस चीज को सुनते ही नहीं है। मैं एक दिन क्या हुआ डॉक्टर दत्ता, एक बच्चा मुजेसर का मेरे पास आया, उसको मैं जानता था जब मैं केमिस्ट शॉप करता था कि इसको कुछ नहीं आता, ये फलाने की केमिस्ट शॉप पे नौकरी करता है। तो वो फार्मेसी के रजिस्ट्रेशन के लिए जब मेरे पास आया तो मैंने कहा अरे तूने फार्मेसी कर ली क्या? कहता हाँ सर मालिक साहब ने करा दी। ये नहीं कह रहा मैंने कर ली, सीधा सीधा कह रहा है मालिक साहब ने करा दी। अच्छा क्या करेगा? बोलो मालिक साहब कह रहे हैं सेल बहुत ज्यादा होती है, इनकम टैक्स का चक्कर पड़ता है, एक लाइसेंस तेरे नाम भी ले लूंगा। मैंने अपने हेल्थ मिनिस्टर के सामने कहा कि सर यदि ये अनिल विज इंग्लिश में लिख दे तो इसकी रजिस्ट्रेशन कर दूंगा, इसको वो भी लिखना नहीं आता। तो मैं सिर्फ इस प्रोफेशन के लोगों से मैं एक आग्रह करता हूं कि ये बहुत नोबल कॉज प्रोफेशन है। मैं अपने मुख्यमंत्री को कहता हूं कि कोई बच्चा बीएड फर्जी करा जाए मुझे कोई टेंशन नहीं है, एमकॉम फर्जी ले आएगा कोई टेंशन नहीं है, वो पढ़ा नहीं पाएगा, उस अकाउंट्स में फेल हो जाएगा और कोई सक्सेस नहीं होगा। लेकिन मेरे प्रोफेशन में उसको ड्रग लाइसेंस मिल गया। आज पंजाब के अंदर क्या है, पंजाब के अंदर वो बच्चा फार्मेसी करके आता है, ड्रग लाइसेंस उसको मिल जाता है, वो कोरेक्स सप्लाई का काम शुरू कर देता है, वो मिड्स कोडिंग सप्लाई का काम शुरू कर देता है, ड्रग इंस्पेक्टर उसको गिरफ्तार करवा देता है, सवेरे उसकी बेल हो जाती है, वो ये शो करता है कि जी मैं तो होलसेलर के यहां से अपनी दुकान तक वो लेके जा रहा था। लेकिन आज मैं आपको कह रहा हूं पिछले 6 महीने से पंजाब के अंदर जो नशे का कारोबार था उस पर पूरी तरह लगाम की तरफ काम सरकार कर रही है। कोई सरकार हो कोई वो, मैं अपने प्रोफेशन की बात करता हूं, मुझे इस चीज से कोई मतलब नहीं कि किसकी कौन सी सरकार, कहां की सरकार। लेकिन मैं आप सब लोगों को, जो फार्मासिस्ट साथी मेरे यहाँ हैं, आज काफी अलग अलग ट्रेड्स के लोग यहाँ बैठे हैं, लेकिन मैं इस फार्मासिस्ट प्रोफेशन से हूं, तो मेरा एक कर्तव्य बनता है कि आप जो बच्चे यहाँ फार्मेसी से हैं वो एक बार हाथ खड़ा करेंगे, कौन कौन है यहाँ फार्मेसी प्रोफेशन से जो लोग हैं, कोई लेक्चरर्स, कोई प्रिंसिपल्स। मैं देखिए बहुत अच्छा लगा मुझे और आप लोगों को भी अच्छा लगेगा। आज मेरी बात को याद कर लेना, जब आप तरक्की पे जाओगे तो आप याद करोगे कि हमने एक अच्छे यूनिवर्सिटी में अच्छे इंस्टीट्यूट से फार्मेसी की। वो लोग जो प्रोफेशन के साथ धोखा करते हैं, चाहे वो कोई भी प्रोफेशन हो, वो सक्सेस नहीं होते। डॉक्टर दत्ता जिस प्रकार से इंडस्ट्री चलाते हैं, आप लोग वहां कामयाब हो सकते हो, लेकिन जो फर्जी लोग हैं ना, वो कोरेक्स और उस धंधे में तो शामिल हो सकते हैं, लेकिन तरक्की के रास्ते गलत रास्ते नहीं हो सकते, कभी गलत रास्ते नहीं हो सकते। डॉक्टर जयबालन जी के यहाँ से बच्चे आते हैं, अलवर और भी कॉलेजेस हैं, मैं नहीं करता उनकी रजिस्ट्रेशन। बहुत लोग सिफारिश कराते हैं डॉक्टर जयबालन, बहुत लोग, मैं नहीं करता। लेकिन आपके यहाँ से जो बच्चे आते हैं, मैं आपके साइन देखता हूं, बड़े लंबे साइन है आपके, पूरा पेज के ऊपर एक साइन आता है आपका, नीचे स्टैंप लगी होती है, मैं देख लेता हूँ डॉक्टर जयबालन के साइन है, मैं करता हूं। मेरी मुलाकात आज पहली बार हो रही है। मैं अपने प्रोफेशन के हर उस व्यक्ति की कदर करता हूं, क्योंकि दवाइयां का काम, मेडिसिन का काम ह्यूमन बीइंग की लाइफ के साथ जुड़ा हुआ है। जो आप एमकॉम बीएड को डिग्री दे दोगे ना, उसको पढ़ाना नहीं आएगा तो फेल होकर के कोई उसको टीचर नहीं रखेगा। लेकिन जिस केमिस्ट की शॉप पे आप जा रहे हो, आपको क्या पता कि उसको डिग्री कैसे मिली थी। वो चीज हमारे पूर्व में हरियाणा के स्टेट ड्रग कंट्रोलर रहे नरेंद्र आहूजा जी, मुझे बड़ी खुशी होती है कि मैंने इनके अंडर इस चीज को सीखा कि मना कैसे किया जाता है, नहीं तो एक बच्चे के अंदर हिम्मत नहीं होती। मुझे इन्होंने एक चीज सिखाई कि आप ईमानदार हो तो डरो मत, और डरोगे नहीं तो लोग आपसे डरेंगे, आपको डरने की जरूरत नहीं है, और जो जो कुछ कहता है उससे डरने की जरूरत है। कोई एमवीएन का ऐसा बच्चा जो 5 साल के अंदर हरियाणा स्टेट फार्मेसी काउंसिल में रजिस्ट्रेशन के लिए आया हो, रह गया हो, तो मैं जिम्मेवार हूं। कोई ऐसा बच्चा जो बीडी शर्मा से करके आया हो, एमडी यूनिवर्सिटी से करके आया हो, जीडी गोयनका से करके आया, केयर मंगलम से करके आया हो, हरियाणा में भी 2-3 यूनिवर्सिटियां हैं, मैं नहीं करता। मुझे पता है कि किसी भी कीमत पे मुझे इस प्रोफेशन को थोड़ा सा समय और है, क्योंकि फार्मेसी काउंसिल ऑफ इंडिया ने एक एग्जिट एग्जाम लागू कर दिया है। वो अगले साल से जब एग्जिट एग्जाम हो जाएगा तो एनटीए जब टेस्ट ले लेगी, उसको एलिजिबिलिटी सर्टिफिकेट मिल जाएगा, तो मुझे भी टेंशन नहीं है। लेकिन जब तक वो टेस्ट नहीं आता तो मुझे टेंशन इस बात की है कि कहीं ना कहीं इस प्रोफेशन को बचा के रखने में मैं डॉक्टर जयबालन, डॉक्टर अरुण गर्ग, दत्ता गक्कड़ साहब, आप सब लोग जितने लोगों ने भी हाथ उठाया था कि ये प्रोफेशन जो है ये किसी की मदद का प्रोफेशन है। डॉक्टर बी सुरेश जब हमें फार्माकोलॉजी पढ़ाते थे तो आज आपको बता दूं, आज तो इंग्लिश के ट्यूटर्स बहुत हैं, इंग्लिश पढ़ने वाले बहुत हैं, पढ़ाने वाले बहुत हैं। मैं बात कर रहा हूं, मैंने 1991 में फार्मेसी पढ़ी, तो जो नॉर्थ से बच्चे फार्मेसी करने जाते थे और साउथ में जाते थे तो लैंग्वेज की इतनी प्रॉब्लम थी कि जो वो इंग्लिश बोलते थे हमने वो सुनी नहीं थी। फिर हम पड़ोसी से पूछते थे ये क्या कह रहा है, तो वो भी साउथ के रहने वाले थे, वो जो लैंग्वेज बोलता था हम कहता था ये भी समझ नहीं आई, तो हम कहते थे बुक अपने पास रखो, जो सर बोल रहे हैं समझ आती जाएगी धीरे धीरे, तो करते थे। तो डॉक्टर बी सुरेश एक ऐसे प्रोफेसर थे कि जो हिंदी में भी सब चीज को ब्रीफ करते थे और बहुत लंबे अच्छे से करते थे। और जेएसएस कॉलेज नहीं था, हम उस समय जब पढ़ते थे उसको जेएसएस इम्प्रिजमेंट कहते थे कि जो 8:30 बजे घुस गया वो 6:30 बजे से पहले निकलेगा ही नहीं। तो वो कॉलेज, वो टीचर, वो गुरु जिन्होंने अपने बच्चों को अच्छे से पढ़ाया उनको सदा इज्जत मिलेगी, और जो बच्चे पढ़े हैं उनको भी गुरु इज्जत दे। लेकिन आप पुराने वक्त को याद कर लो, गुरु कान भी पकड़ लेते थे, मारते भी थे, डांटते भी थे, लेकिन अब वो समय तो नहीं है। डॉक्टर बी सुरेश जब पढ़ाते थे वो फार्माकोलॉजी, तो वो कहते थे भाई बात ऐसा है, हम जिस प्रोफेशन में हैं छोड़ दो कि आप ये कोर्स करके चले जाओगे, ये किताब आपके काम नहीं आएगी, लेकिन आपका दिल और आपका दिमाग काम आएगा। वो क्या काम आएगा कि आपके पास एक बंदा जो आ रहा है वो स्वस्थ नहीं है, वो हेल्दी नहीं है, वो मेडिसिन का पर्चा हाथ में लिए खड़ा है, वो इरिटेटेड है, परेशान है। आपने उससे जब बात करनी है ना, यदि वो बुजुर्ग है तो अंकल आंटी दीदी बहन जी, ये सवेरे दवाई आपने खानी है, ये दोपहर को 2 टाइम खानी है, ये 3 टाइम लेनी है, उसके अलग इन्वलप बना करके उसके ऊपर लिख दो कि ये सुबह खानी है, ये रात को खानी है, उसके अच्छे से बता दो। तो 2 चीज होंगी, एक तो वो आपको आशीर्वाद देंगी, जो पेशेंट होगा वो आपको आशीर्वाद देगा, और आपकी जो सेल है वो बहुत बढ़ जाएगी। तुम कहते थे सेल कैसे बढ़ जाएगी? बोला वो जो बुजुर्ग गुजरा, जो पेशेंट है ना, वो 10 जगह बैठता है, वो कहता है वो बच्चा है ना वो अच्छा है, वो अच्छे से समझाता है, वो केमिस्ट शॉप वाला अच्छे से बताता है, तो आपकी भी बात रेपुटेशन की आती है और उस पेशेंट को भी अच्छे से सारी चीज समझ। आज मैं तहे दिल से शुक्रिया अदा करता हूं एमवीएन यूनिवर्सिटी की मैनेजमेंट का, वरुण शर्मा जी, उनके पिताजी गोपाल शर्मा जी, मुझे अच्छे से याद है हम लोग विद्या मंदिर में पढ़ते थे और उस समय 2 स्कूल होते थे, मॉडर्न विद्या निकेतन और विद्या मंदिर। विद्या मंदिर के अंदर एडमिशन, ये सोच लो कि एमएलए मंत्री का बेटा नहीं पढ़ सकता था। आज किसी अफसर, दुनिया भर के डीसीएसपी आते थे, टेस्ट लेते थे, बच्चा ठीक है तो ले लिया, नहीं तो आउट। आज उसी चीज को आपने मेंटेन रखते हुए यूनिवर्सिटी लेवल तक उस चीज को आप लेके आए हैं। मैं इस चीज के लिए आपको बहुत बहुत साधुवाद करता हूं, बधाई देता हूं, क्योंकि मैं इस प्रोफेशन के अंदर देख रहा हूं कि एमवीएन यूनिवर्सिटी के बच्चों को मैं पूछता हूं भाई इसका मतलब क्या है, इस चीज का मतलब क्या है, इस चीज को कैसे यूज करोगे, तो वो बच्चे 2 मिनट में बताना शुरू करते हैं। तो इस चीज का बड़ा फर्क है। मैं आप सबको जो आज इस फरीदाबाद की पावन धरती पर आप सब लोग यहाँ आए, बहुत दूर दूर से इंडस्ट्रियलिस्ट भी हैं, सारे साथी भी हैं, मैं सबका स्वागत करता हूँ और एमवीएन यूनिवर्सिटी मैनेजमेंट का तहे दिल से शुक्रिया अदा करता हूँ कि आप बच्चों के लिए रोजगार के नए से नए आयाम ढूंढ रहे हैं, ये बहुत अच्छी बात है। और सबसे बड़ी बात यह है कि आपने एक ऐसे व्यक्ति को यहाँ पर डॉक्टर दत्ता को बुला करके सब लोगों से रूबरू कराया, ये बहुत बड़ी बात, क्योंकि मैंने बहुत समय से नाम डॉक्टर साहब का सुना, लेकिन सुना मैंने आज पहली बार, तो बहुत अच्छा लगा। आप सबका बहुत बहुत धन्यवाद।
Thank you, sir. Thank you very much. I request you all to please stand up and have a huge round of applause for Shri Dhanesh Adlakha ji.
देखिए महानुभाव, मुझे फार्मास्यूटिकल इंडस्ट्री में किसी भी फोरम पे बुलाया नहीं जाता। उसका रीजन ये है कि फार्मास्यूटिकल इंडस्ट्री के अंदर मैं आपको एक एजुकेशन दे रहा हूं, 22,000 करोड़ रुपए की ऐसी दवाइयां हैं जिनका ड्रग कंट्रोलर से अप्रूवल ही नहीं है इंडिया में। लानत है हमें। और मैं आई स्ट्रांगली बिलीव इन मिस्टर लखा कि सारा जो काम है ये रिटेलर केमिस्ट कैसे करते हैं, क्या करते हैं, जो बहुत बड़ी गलत बात है। वी आर हेयर टू सर्व द नीडी पेशेंट्स, और जब तक हम पेशेंट की सेवा का भाव नहीं रखेंगे हमारी इंडस्ट्री सक्सेसफुल नहीं होगी। वर्ल्ड के अंदर फार्मेसी काउंसिल के लोग ज्यादा कमाते हैं देन डॉक्टर्स, सारी दुनिया में। यूरोप में जाइए, अमेरिका में जाइए, फार्मासिस्ट अर्न मच मोर देन द डॉक्टर्स। हम अपने प्रोफेशन को नीचे नहीं आने देंगे। ये हमारे को आज एक प्रण लेना चाहिए कि वी मस्ट अपग्रेड आवरसेल्व्स टू बी ए पार्ट ऑफ ए वर्चुअल इंडस्ट्री व्हिच इज गोइंग टू मेक द वेल-बीइंग ऑफ पीपल। आई एम नॉट talking treatment. We are in the well-being industry. God bless you all. God bless Adlakha ji.
Thank you so much, sir. Thank you for your benign presence. Now, I would like to request Dr. Rajiv Ratan, Registrar, MVNU University, to propose a vote of thanks.
Thank you, ma'am. So, good afternoon, everyone. Someone has rightly quoted that thank you is such a prayer that cannot be seen or touched. It must be felt by heart. So I feel really honored and privileged to get the opportunity to propose vote of thanks on this special occasion. First of all, I would like to thank our chief guest Datta sir, Adlakha sir, Balan sir, Bhalla sir, or Gil sahab, Gakhad sir. I would like to thank everyone who spared their valuable time and blessed us with their presence. I'm also very much thankful to our program advisory committee members and all the invited speakers. Words are not enough to thank their constant guidance and support to shape their confidence. I, on behalf of this organizing committee, convey deep regards and heartily thanks to our worthy Chancellor, Shri Varun Sharma ji, Managing Director, Shrimati Kanta Sharma ji, ex-Chancellor Shrimati Santosh Sharma ji, Director MVN Society Shri JP Gaur ji, our Honorable Vice Chancellor Sir Professor Arun Garg sir, and our Honorable Pro Vice Chancellor Sir Dr. NP Singh. Dr. NP Singh, they supported in all possible manner to organize this conference. And my special thanks to our Dean Academics Professor Dr. Yogendra Singh and Dean Research Professor Binesh Singh, who coordinated this flawless event. I'm very much thankful to all our deans, heads, faculty members, and non-teaching staff members who always stand by us in all Herculean tasks. Thank you, everyone. An event of this dimension cannot happen overnight. The wheels start rolling months in advance. We have been fortunate enough to be backed up by a team of very motivated and dedicated students, committees, and volunteers. Thank you, students. Thank you, volunteers. I cannot thank everyone enough for the involvement they have shown and the willingness they have expressed to take on the completion of tasks beyond their comfort zones. I feel proud and thank you everyone for making this event a successful one. Thank you, everyone.
Thank you so much, sir. Now there is an important announcement for all of you for the post-lunch sessions that will start sharp at 2 p.m. The students of pharmacy will still stay here in the amphitheater only. The post-lunch session will be conducted here in the amphitheater. School of Engineering and Technology students, your session will start in Block 2, first floor. The students of School of Business Management and Commerce, Block 3, first floor. School of Law, Block 3, second floor. School of Agriculture, Block 4, first floor. Bachelor of Physiotherapy students, floor. And Allied Health Science students, Block 5, second floor. This is an information regarding the post-lunch sessions.
The national anthem isn't merely a song, it's a sacred hymen that reverberates with the essence of our nationhood, reminding us of the values we hold dear and the unity that binds us together. Let us carry this spirit of patriotism with us as we depart, knowing that in our diversity we find strength and in our unity we find hope.
जन जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल दायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
All the students now can leave for the lunch that is organized in the front lawn of the university. The 5 students can come back at the amphitheater at 2 p.m. Thank you all.